they know probably is a better chance to treat early. For the people who don't know they have it and are able to test and test positive, they know to socially isolate. We can limit spread. We also know that the more we test, the more data we can get. Find out the percentage of infection. We can actually look at tests that work and don't work. And we can also check tests. We can do a checks and balances of tests where if people are being tested for both antibodies and for the virus, we may be able to catch some things and some flaws in the testing. So the more testing, the better has been more or less a consensus discussion. The real problem has been how to do it and how to find tests that work. The University of Arizona has developed a unique antibodies test in that it samples for all three of the antibodies that it's supposed to look for. Now, that doesn't mean it's a foolproof test, but it is a test that, because it's the best we have, something we can count on. Moreover, two local labs are facilitating tests around the country. The bottom line is that we've received a specific amount of CARES Act money in the city to help combat this disease. And I think using those resources to increase testing within Tucson gives us a better chance of combating with the disease. Moreover, it also opens doors up for later possible remedies, including testing for convalescent plasma, including testing for antibodies and other items when it comes to testing. So we have all these opportunities. And if you talk to any health professional in the country, they'll say we have to be, the more testing, the better, albeit as accurate as possible. So that's what I think with the CARES Act money, I think it's a really important piece where we can probably take some of that money and work on a ready testing program. We can work on a program where we do ready testing, and obviously we'd be coordinating with the University of Arizona, we'd be coordinating with Pima County as those results would get passed through, and also be able to provide virological tests for both city employees and ultimately the public. Right now, to go in without any referral from a doctor, you cannot get tested. If you want to get tested kind of with okay symptoms, you still have to pay as much as $174 in most cases. I want to be able to set up a program where if people want to register on a website, they can go in and get tested. And those results would go directly to Pima County Health. Pima County Health would coordinate whatever the results are. They tabulate the results, which they're already doing. They report the results to the state, which they're already doing. And I think to some degree, they work on the contact tracing piece, which I believe they're already doing. Moreover, I think coupled with this, we'd have the opportunity to turn these tests around within 24 hours. I think we can find a lab that is capable of doing that. This is about peace of mind, and this is about people being able to feel safe, knowing that more and more people are being tested, but also, and probably more importantly, this is an opportunity for some of those folks who are worried. I've talked to so many different constituents who have had a cough or a couple sneezes or a headache over the last 6 weeks, and they've been scared. And this is an opportunity to say, hey, you don't have to be scared anymore. We're going to get you tested and find out and make sure you're okay. And I think that's a big part of our community health. This would only be a program that would last a couple months because, as Dr. Carmona said, quite a few new testing programs are coming along. We're not going to need this program for a long time, but maybe for 30 to 60 days where we test the goal would be to test about 1,000 people a day, give or take. And then maybe some additional people with the antibodies test if the U of A wants to coordinate with that. But the bottom line is that we provide that money to do that. We've limited the testing piece to the experts, to the healthcare professionals and the labs that are already doing it. And we coordinate with Pima County to do it. And I think if we have a testing program like that with, say, 6 sites in each ward, we could have something special and unique that the city could have. But every single day that we wait to set up a testing program is another day lost to collect data, is another day lost to be able to get this online. We've now waited a month. We could have had a program like this as much as 2-3 weeks ago, because we didn't get our CARES Act money until then. But this has been the first meeting since we got that money. So I think this is the time to kind of start that process and get that action taken. So first of all, before I make my motion, is there anything, Dr. Carmona, that you want to add in after my comments?
No, thanks so much for the opportunity to speak with you. Thanks for taking the time to contact me and send me the information so I could review. I think there's a lot of great ideas in what you have presented. My concern is, of course, more globally, that I would like to see the entire region unite and not have a separate plan for the city, separate for the county, separate for the university, because all 3 entities are working on that right now. And again, since the city makes up 2/3, 3/4 of the population, it would be important that they have a major seat at the table and weigh in on what the best plan would be. These are very complex issues, as you know, as to what type of testing, how often, the timing of the testing, because if you don't do it correctly, you get bad results. Plus, you have to validate that whatever test you're using is good. So my recommendations would be, as I've told you and the mayor, that with your terrific ideas and what I'm hearing from the county, what I'm hearing from the university, hopefully get together a group of people that can be able to generate a plan that is satisfactory to be able to protect our community and gather all of the data we need to make the decisions we need as far as policy, the spread of disease, tracking all of those things, tracking and tracing, like you said, as well. So that would be my recommendation, and hopefully the council would agree that next steps would be to have those discussions with the university and Pima County.
Here's a question from a governmental standpoint, Doc. Look, the bottom line is that if we make the motion today, which I want to do, we at least can free up the money to start the process. Yeah. I think that's really important. I don't want to have to come back and wait and start again. So I want to start this process today.
I understand it, and I don't disagree with that. My intention to be here is just to give you some advice as to what I would believe might be the best path forward. The decision to accept the money and your political activities, clearly up to you. But I think we're heading in the right direction, and certainly funding will be required to do a lot of this stuff. So getting it would probably be a wise thing to do.
Dr. England, do you have anything to add at this point?
Yes, thank you, Mayor, members of the council, and Senator Carmona. I appreciate that, and I appreciate your sharing the first sort of outline of your plan that you presented to me, I believe 2 or 3 weeks ago, whenever it was. I'm really grateful for the opportunity, for the desire of the city to bring extra resources to bear on this. I think it's super important. You're right, we don't have enough testing at this point in time. I would consider enough viral PCR testing to be when any doc can order it for any patient as they see fit. When we can do repeat screenings in high-risk settings such as long-term care, other assisted living type of facilities, other congregate settings, so that we can nip outbreaks in the bud instead of witnessing some of the devastating outbreaks that we've seen. And I think antibody testing is mostly useful at this point on a population basis for certain populations to see what's going on. So the devil's in the details. And I agree with Dr. Carmona completely about getting together on a plan so we can prioritize the resources that we do have and target those who need it most first as we roll this out. Having said all of that, again, I'm incredibly grateful for the offer of assistance from the city for this. This in the long run is going to be really helpful. And I hate to tell you, some variation of this is going to have to last a lot longer than 2 months, I'm afraid. And we're going to need to create our plans with that in mind.
Well, thank you, Dr. England. This is the mayor, and I just wanted to thank you for also being part of the conversation today, representing Pima County Health Department. The memo that the vice mayor and I sent really is talking about a long-term plan. As you said, it's not just a 2-month piece of work, right? It's not a 2-month project, but as Dr. Carmona has said, you know, the city of Tucson is almost 2/3 of the population in Pima County. And we understand completely that Pima County is in charge and responsible for the health of our community in its entirety, not just Pima County residents, but the city of Tucson residents. And so I too believe that coordination and conversation between Pima County, of course, the University of Arizona having their antibody test, and having researchers and scientists that know much more than I do in terms of the science of all of this. I am a policymaker, and the reason I wanted to sign on to this particular memo, talking about not just testing, but what does the future hold in terms of planning, planning for health of our community in the long run. Without having a vaccine, we all have to get ourselves on the same page for the benefit of the community. So I know that I have been having conversations with Pima County, with Chuck Huckleberry and Dr. Garcia about how we coordinate, update each other, and then, as Dr. said, put a long-term plan together, the 3 jurisdictions, so that we inform our community, let them know what we're all doing. So on the testing side, as important as testing is the tracing. And I know that Pima County is ramping up their contact tracers. Can you talk a little bit about that, Dr. England?
Romero, absolutely. We are, by the end of this week, on track to have our final plans in place, but we recognize the need to, in order to do it really thoroughly, which the community expects at this point, I think we're going to need a lot more people. So we're looking at contracting out as well as tapping the many partners we've already been using. We've had tremendous help from the university, with the graduate epidemiology students at the College of Public Health and others. We've had help from the Medical Reserve Corps of Southern Arizona. We've moved other resources around, but it's not going to come close to the manpower we need. So in the long run, it will be some sort of contracted service as well. The point is that when a disease becomes really commonplace, really widespread like this, attempting to do old-fashioned contact tracing, isolation, and quarantine just gets incredibly difficult. And the default that public health had to do at the start of this outbreak was to do more universal application of measures. Thus, all the social mitigation that was put into place. For us to be able to loosen up that social mitigation safely, you need to do a lot more intense tracing, isolation, and quarantine. That's the upshot of doing all that tracing. And to Vice Mayor Cunningham's point, be able to test appropriately people in that contact tracing process. That's huge. And throughout the early part of this, we haven't been able to get that done very well.
Vice Mayor, and I believe Dr. Carmona will have to leave, but I appreciate his time. I don't know if he's on our call anymore, but I really appreciate his time. I am happy that Dr. Carmona is working both with Pima County and the University of Arizona, and so I just wanted to thank him for his time, but he does have another meeting to run to, and hope that we can continue working together with the University of Arizona, Dr. Carmona, the City of Tucson, and of course Pima County. I just wanted to note that Dr. Carmona had to leave. Vice Mayor?
So before I want to just make sure of a couple things. I want to make this motion. I want to make sure that on the testing piece that we can put out some money to kind of start the process, but I want to pay for the tests by the tests long term. I don't want to be in a situation where we get billed $5 million and only have 80 tests done. So I want the manager to consider that before I make this motion. But the motion is this, that I move that we direct the city manager to coordinate with the University of Arizona, with Pima County, and with other health authorities to initiate a program for ready COVID testing, starting with city employees and then transitioning it to the public. The underlying goal is to test about 1,000 people a day for 45 to 60 days. And again, the reason is because I think tests will probably evolve in that time, and this bridges that gap. So that's my motion.
I'll second it.
So there is a second, I believe, from Councilmember Lee. Alrighty. What you're envisioning, Vice Mayor, is that we start with City of Tucson frontline workers and then work our way into all of our city employees?
Well, first of all, we have so many different, our first responders obviously need to be tested regularly. But if you're picking up garbage, if you're one of our environmental services workers who's in the field every day, if you're one of our water meter readers who's in the field every day, if you're working on the street potholes and you're in the field every day, you deserve to be tested. We need you to know our people, all of our people along over the city are putting themselves at risk. Our bus drivers, they deserve to know. So I want to have that universal ready testing available for them. And, you know, there's some logistics that we're going to have to work out. That's why we've got to coordinate with the county and the U of A so that we don't have people running around. We also need to be in conjunction with the testing that already exists. But the ultimate goal is we're going to be adding a net of between 500 to 1,500 tests a day, some virological and some maybe some additional antibodies with the U of A over this period of time. And at first, I think the testing will really ramp up and a lot of people will want to get tested right away. And then I think by the website, you'll see it kind of die out. That's kind of the vision. But I want to get started. I don't want to wait anymore. I think we've been talking too much, and we need to get the experts in the room, put them to action. And quite frankly, I don't want to sacrifice a big chunk of our CARES Act money, but if we can cap it at $3 or $4 million, I think we're fine. I don't think we'll end up spending that much. But the bottom line is that we need to get this process started, and we need to get these testing programs started as soon as possible. I mean, I don't want to get too far into the weeds on it. Let's let the community experts kind of figure it out. But the vision is yeah, we're going to start testing employees possibly every 30 days or anytime they present symptoms, and we're going to test members of the public, especially the underinsured and uninsured, and that's important.
Well, and also I think that it's equally important that we start with the frontline workers, as you said, and that's first responders and bus drivers and those that are have exposure to dealing with the public, the essential workers, right? What I wanted to do is open up the floor for our city manager Ortega, to jump in with your thoughts.
Thank you, Mayor. just a couple of points of clarification so that I'm clear on where we're headed. Number one, you're looking for a coordinated effort between Pima County, the U of A, and other health professionals or health authorities to develop a testing program. Sounds to me like the priority would be city employees, and then further priority would be for, we'll call those essential workers that are out in the field first, all others second. I would recommend that be on a voluntary basis as opposed to mandatory. So
Absolutely.
Employees can have a choice there. Vice Mayor, you mentioned virological or antibody. What are you thinking? I mean, there's a difference there, and we make sure we're clear.
So the vision would be we want to get about 1,000 virological tests per day. Starting with the city employees and then available to the public. But the other thing is that the U of A has this antibodies test, and assuming this antibodies test is proven to be very reliable, I'm absolutely good with us if the U of A believes that they have the capacity and they can use the extra funds to expand their capacity in Tucson, that we assist them in doing that. I don't want to overspend on it, not more than, again, like I said, how we spend this money is up to you. I don't want to really go over $3 or $4 million, $3.5 million. Should do it, could do it. But if the U of A gets say $300,000 and they're able to expand their capacity to 500 people in the city of Tucson, that's fine with me. And that's up to you guys. And that's going to be a discussion that's going to happen when you're coordinating with the county and U of A. So we can't direct you to do that here. We can give you the latitude to do that if it makes sense. But again, since I am not a public health expert, and nor do I want to try to pretend to be, as Dr. England said, we need to be coordinating our efforts with Pima County. And so that's kind of the vision, is I'm leaving that open-ended because as Dr. England said and Dr. Carmona said, you've got these virological tests and these serological tests, the PCR and the serological, and both of them have different functions. And so we've got to be able to understand those functions and use our resources appropriately.
Thank you.
So Mayor, I'm sorry, Mayor, because I want some clarity on this. It seems to me that maybe the group that gets together can identify the type of testing. Obviously, those that are symptomatic would be highest priority, I would suspect. One of the things that we'll have to be sensitive to is those tests are finite right now, so we'll have to make sure we can procure them, et cetera. You also mentioned testing employees every 30 days or so.
If they want to.
One more time.
So if you're a field worker and you're worried about your exposure, if they can test first, and then if they want to come back 30 days later, even if they're symptom free, we should allow them to get tested. Absolutely.
So Mayor, one of the things that I would suggest, if it's okay with the council, let me put together a team to look at this, simply because we've got to go through procurement to identify testing systems and all things go along with that. But that's actually after getting the health professionals together and talking through this issue. If you don't mind, I'd like to bring it back with a report. I believe there's a meeting on June 9th. Happy to do that. We can start moving this forward quickly on our end, but if I need additional guidance or more of a report, I'd be happy to do that then as well.
And Mike, if you're able to at least get a portion of the testing piece done and have the blessings of the group, knowing that it's coordinated, it shouldn't be that fast. I mean, that slow a process where it's going to take 2 months to kind of get this off the ground. Right. The bottom line is that I think we've kind of got some of the things in place, and we kind of know some specifics on the vision. So I think we'll be able to execute. But every day, just remember, time is critical. Every day we wait is a day lost. The governor's going to open this state back up, and I'll be damned if he's going to open this state back up and our city not have widespread ready testing for everybody who needs it.
Right, and the way we can start it up, I would also advise Vice Mayor that City Manager Ortega devise a plan in a phased approach. In other words, like you mentioned in your motion, that we start with our frontline workers, and then expand to the rest of the city of Tucson employees. And then as we move from that phase, maybe even expand to the families of our city of Tucson workers. And so, but it really has to be a coordinated approach, and make sure that those conversations, as you said in your motion, with the U of A, with Pima County, especially because Pima County is responsible for tracing, that we all coordinate and move as quickly as possible. I don't know if I feel comfortable with waiting until the 9th, Mr. Ortega. I'd rather you move.
Your Honor, I'd probably say I don't think they need to bring back any plan if testing's running. They don't need to bring it back to us before they start. I'd more see the 9th as kind of a progress report to see kind of where we are.
Alrighty.
And that would be where I'm at. But again, like I said, every day we wait,
Yes.
it costs us. So we've got to have it. And I think that, again, as we talk to some of the health authorities, the health care providers that may help us facilitate the testing, or one of the labs that helps facilitate the testing, I don't know which lab would be, any of those things, they'll kind of give us some guidance on how we can execute this. Obviously, the county can give us some guidance on how we can execute this within their framework. I think we'll be okay.
Vice Mayor, let me open it up for comments from our colleagues. Councilmember Lee is on the queue, and then Councilmember Kozaczek.
Hi, everyone. Thank you, Mayor. I just want to thank Dr. Carmona, Dr. England, and just this whole conversation has been very insightful. I really like the idea of a single unified consolidated plan. So I'm really on board with that. Just a couple questions for clarification. And the city manager mentioned the voluntary nature of this program for city employees, which was one of the points that I had. I just wanted to ask Mr. Rankin if he could just, from a legal perspective, if there are any concerns, sir, that you have around this program in any way, shape, or form, just out of curiosity to get your opinion.
Councilmember Lee, thanks for asking. There is EEOC guidance on what the employer's rights are and the types of requirements that the city as an employer can put in place with respect to its employees. We certainly have some responsibilities with the confidentiality of test information and results. So we will make sure we incorporate that into the program. But clearly making this voluntary for the employees it's a permissible initiative that the council could launch on. In fact, the guidance by EEOC at the current time is that an employer can actually mandate testing for employees before they report to work, so long as the testing that they're using is accurate and reliable. So certainly the proposal as included in the motion is something we can do.
Okay, thank you, Mr. Rankin. And then one other note is, Mr. Ortega, when is the period of spending the CARES Act funding? Is that 2020?
Mayor, Councilmember Lee, the guidance is through the end of the calendar year, which is December 31st of 2020.
Okay, so maybe one thing that we would maybe want to add to the motion is to put a cap on the program of maybe $3 million to be spent by the time the CARES Act money has to be spent. So just something that would give us a finite cap on what we want to spend. And again, like you had mentioned, Vice Mayor, the demand might not be there and we're going to pay per test. So we might not get anywhere close to that, but we might want to put some guardrails in for the program. 4 million. Yeah, just those are just my comments.
That's acceptable as a friendly amendment.
Mayor, maybe before, and
yes.
I was going to ask about that. Vice Mayor mentioned 3 to 4 million. why don't we just maybe shelve that for a little bit until we get a handle on the amount. I mean, we have some idea in terms of amount per test, but let me get my arms around what that's going to look like. Then I can come back with a recommendation for you on what those dollars might look like. It doesn't have to slow anything down in terms of the actual process, but you know, I just don't know if 4 million is enough, if 4 million is way too much. I don't have a feel for that at this point. So I would just suggest maybe hold on.
We also have to remember that Pima County received CARES Act funds as well, in the amount of, I think it's about $83 million. And so the coordination with Pima County and their plans in terms of community testing are really equally important, right? Because of Pima County's responsibility for public health. So I agree with the city manager that we need to, instead of putting a cap right now or an amount right now, I think that that coordination and that conversation has to happen.
Well, if Your Honor, I'd say this: don't spend more than $3 million by June 9th. Okay.
Mm-hmm. That's a good deal. That's a good deal. We have Councilmember Kozaczek. I don't know if you were done, Councilmember Lee, or if you had any other questions.
I am done. Thank you, Mayor.
Okay. Alrighty. Councilmember Kozaczek and then Councilmember Fimbres.
Is Bob England still on the call?
I am.
Good. Okay. I'm sorry Carmona left because I had some questions for him, but Bob, you'll be able to fund these. First of all, Paul, would you reread the motion? Because there's been a lot of conversation since you read the motion. I just want to be clear on what we're actually.
Yeah. Give me sorry, I dropped my thing. I'm just picking it up. Just hold on.
Just reread the motion without all the other.
I move that we direct the city manager to coordinate with the U of A, Pima County, to initiate a citywide ready testing program, starting with city employees and then transitioning to the public. The underlying goal is to test 1,000 people a day for the next 45 to 60 days.
Okay. So Bob, Dr. England, well, first of all, the motion did not stipulate what kind of tests. So all you're doing right now is setting up and this is what Richard Carmona said, is just convening a meeting to talk about this, but there seems to be more conversation going on about actually beginning to implement the testing. I've spoken to El Rio, the county, TMC, hospitals. Every one of them agree that there's no sense in standing up a new system and that we can use the money that we have in place to financially support what's already in place. Hospitals have furloughed staff, their docs, their nurses, their technicians. They have the expertise. They have the infrastructure. They could stand up clinics tomorrow if given the funding. And focus on symptomatic and vulnerable populations. So we also need to make sure the testing is being done in a geographically equitable way. It covers the city. So my question, I guess, of Dr. England is, are you prepared, you the county prepared to chair this? You're the healthcare authorities. Are you working already with the hospitals and the clinics to do this? I'm just not sure if we have dollars to spend, why we wouldn't invest in the systems that are already in place and have you coordinate this. I'm not quite sure what we're adding or bringing to the table that doesn't already exist.
Before Dr. England answers, I believe that's the direction of the motion, and I just want to make sure that Vice Mayor Cunningham is directed in that way, and that's the whole reason why we started the conversation with Dr. Carmona, so that we can coordinate. Part of the conversation today, Councilmember Kozachik, is to make sure that the city of Tucson is playing an important role in this question about testing and then the future planning for our community living with COVID-19 until we find a vaccine and other solutions. But I believe, Vice Mayor, the intent of your motion is to specifically do that, to work with Pima County and
everything that Steve said is exactly what I just motioned.
That's exactly right.
That's why we included the health authorities in there, because we want to go to them right away and say, start. Mm-hmm. The bottom line is that we need more testing. And we have CARES Act money, so let's use CARES Act for testing in the work of already what's been doing. That's what the motion says.
That's perfect. That's
exactly what the motion's for.
Yeah, and if it is working with Banner, or if it is working with El Rio is doing an amazing job in terms of testing. The state handed some funds over to El Rio Clinic. They have been, according to Chuck and Dr. Garcia, they have been doing an amazing job in terms of testing on the weekends for the governor's testing blitz. And so we don't have to reinvent the wheel. I think that we just want to make sure that the city of Tucson is present and coordinating and in the conversation with Pima County Health Department as we proceed. So
Your Honor, there are 4 variables here. There's lab capacity, there's testing capacity, there's personnel capacity, and then there's coordination. Those are the 4 variables. It's not that simple. And so, of course, we want hospitals who have extra people to be able to facilitate more tents, but somebody's got to pay for the tents and set them up. Not only that, we can't have them not duplicating things that are already being done nearby. So that's why you have to have the county involved. You also want to be able to do situations where, if you're thinking into phase 2 and phase 3 of the plan that I wrote, you're thinking about people who test positive for antibodies being able to get a PCR test as well, because that makes them eligible by the standards of the Red Cross to donate convalescent plasma if you're thinking ahead. So we have all that is incorporated into this, but I wanted to keep it more within our lane. Our lane is we just need to tell the manager, look, try to get it so we get our employees tested and our people tested. And the best way to do that is to give them some direction to start that process. I just don't want to be in a situation that it takes us 3 months to talk about how we're going to do it. Every day we wait is a lost day. So if we tell them, hey, we're gonna allot this money and the underlying goal is to test the people, that's what we're telling them.
Thank you, Vice Mayor. I just wanted to make sure that we move along. There's Richard. Councilmember Fimbres has questions.
I'm not done. Bob England is ready to respond. And there are more than 4 variables. There's also how often are you going to test. It doesn't provide any confidence to anybody if they know that 95% of the people walking around the community are negative, which means that 95% of the people can still get sick. There are still some questions about false positives on the antibody tests. So that's not a slam dunk that you've got this herd immunity if you get 70% of people coming in with positive on an antibody test. But I just want to be sure that all we're talking about is freeing up CARES dollars to support systems that are in place and that we're a part of that conversation. That's really what you're talking about.
Councilmember Romero, and yeah, absolutely. The devil's in the details. That's why you need to work it out in a group committee setting. Everything that's been said by everybody is essentially correct, and that's part of the problem. We really appreciate the extra resources that this presents. Understand, resources aren't all the problem either. We have had on order massive amounts of testing and supplies to support testing, PPE necessary for it and such for months, literally for months. I've got stuff we're still waiting on from March that we paid for. So money isn't everything. Don't be despondent if you don't see massive results right away, but we'll certainly do as much testing as we can in the highest priority locations as we can. For example, we're trying to do it right now with long-term care facilities, just as you mentioned, for city employees, for not just the residents, but also the staff of those facilities. So this is very much appreciated, and we won't delay. We'll get on it and figure out the best way to ramp this up. Thank you.
Thanks. I have a question, Mike, or for the city manager as well. So, Mike, what is the process that you have in place for actually spending and freeing up CARES money? We seem to be coming up with ideas every week. Last week, the council voted to put in place an equity protocol. We haven't seen that assessment tool. We just can't be one-offing these ideas without and chipping away at the CARES money without some idea as to who's really making the decision, who's really kind of watching the kitty to make sure that we're not spending it down $5-10 million at a time. So what's the process that's in place? What's the status of the equity protocol? And how are you tracking these requests and decisions?
Mayor, Councilmember Kozaczek, so the first is next here under the same agenda item, we're going to talk about the funding memo. I want to go over that, what my recommendations are on that. Assuming that I get feedback between now and June 9th, my plan is to bring back a resolution to the council for, I'll say, whittling down exactly where those dollars and what those plots will look like, give more specificity and guidance to us that is consistent with the guidance that we've got from the feds. So that's how I see that playing forward. At that time, we'll also be able to outline for you what commitments have been made by the council to this point, and also what other ideas and what flexibility we need to build in to make sure as these kinds of things come up that we're able to have that conversation. With regard to the equity conversation, we're still looking through that. I can tell you I did see a memo from Councilmember Santa Cruz yesterday. I will share that with the council as to some of her thoughts, bringing some specificity to that. I have not had a chance to discuss that with her, but I plan to do that here shortly.
Would it be fair to, well, it is fair to say then that based on the motion that passed last week for that protocol, that we really can't commit any of these dollars until we run them through that test?
I would say that we need to have the discussion with regard to what that looks like. So yes, sir.
Councilmember Fimbres, and then I don't know if anyone else is in the queue, then we'll there's a motion on the floor. We will vote and then move on. This item is pretty long and dense, and so I want to make sure that we're conscious of the time. Councilmember Fimbres.
Thank you, Madam Mayor. I understand that. Thank you, Dr. England, for all your efforts and work on this, and you've been a really good person to alert and calm the citizens of Pima County down. And I appreciate that, and I thank Dr. Carmona, who's been really good also as a Surgeon General. I've known him well with our work with the Sheriff's Department. For the sake of, we have also CVS and Walgreens that are also providing testing sites, and I want to make sure, what I'm hearing, Madam Mayor, is that you're going to help join and convene a meeting with Dr. Carmona, the university, Pima County, and yourself, and everybody else that can get folks here to work. We're on board as one unit working together, a coalition of folks. Am I right? Hello?
Yes, Councilmember Fimbres, I will actually get out of the way and have the city manager convene those meetings. Okay. So I think it's important that, you know,
Mike, you're already meeting with Mr. Huckleberry and several others, right? Who's the part of that committee that you're working with?
Mayor, Councilmember Fimbres, I'm sorry, excuse me.
It's the EOC.
Sorry, go ahead.
Mayor.
Go ahead.
Excuse me, Mayor, Councilmember Fimbres. So our EOC meets with the county on a regular basis. We coordinate very closely with them. Our commander, Chris Anderson, has been the one that's been our key point of contact there. We, on a separate level, will meet. I meet with Chuck and talk to him at least a couple times a week with the regional managers. That's where this kind of a conversation can come up.
Okay, and I understand on the EOC reports, come Friday, they should have a tracing staffing strategy along with the testing process strategy. Am I correct on that, reading that from this coming Friday? We should have more information and a guidebook basically to where we need to go.
Mayor, Councilmember Fevers, that would be my expectation. And that's the county EOC report as well as our EOC report.
Okay, and I know that Steve's got a good network out there also, Councilman Kosacic, working with folks also about this issue. And we're also looking at the one population, nobody's talking about the homeless population and people that are lost that also could be, don't have a place to go, so it's easy to spread the issue if they have it. So that's another population we have to be cognizant of and get tested. We got to protect our employees. And everybody has contact with the public. It needs to be tested and their families. Like, I'm glad you brought that up, Madam Mayor, about that. That's crucial. I know that Councilwoman Santa Cruz has mentioned the same thing. So right now we're just pushing the motion that we're going to adjourn this and get coordinated better. And then we'll look about the dollars when city manager brings it back to us, right?
Yes.
Okay.
I'd like to.
I'm sorry, excuse me.
Richard just made a really good point. I have seen one city employee wearing a mask when out in public. This is with the exception of TPD. One city employee, with the exception of Richard and Mark Kerr right now, when they're out in public wearing a mask. We need to be modeling this when we're out in the public. That's TDOT employees, that's water employees, that's all of our workers when they're out interacting with the public. I've got a custodian guy who comes in the ward office here twice a week, great guy, never wearing a mask. So if we're going to be talking about protecting our employees and modeling this behavior, we got to be showing that when we're out in the public as well.
I agree, but I agree with Steve, but we still got to make sure that all our employees have the equipment that they need, the PPE equipment that they need, the masks, the gloves, etc.
Yeah. And you can wear a bandana.
If I may, I think that we're deviating, and I think we still have time to talk about the reopening plans that the city manager put in front of us. But just to Councilmember Fimbre's point regarding homeless communities being tested, we are already doing that. The Community Development Department is really working very well in partnership with El Rio Clinic. That's why I believe that El Rio is a huge piece of our conversation, and hopefully we can rely on them to help us move forward with our testing our employees, and their families. So with that, a motion is on the floor. There is a second, and I think it would be appropriate for us to go to roll call.
Santa Cruz.
Aye.
Mr. Cunningham.
Aye.
Mr. Durham.
Aye.
Mrs. Lee.
Aye.
Mr. Fimbres.
Aye.
Mr. Kosacic.
So to clarify, we are convening under the city manager's leadership a meeting with all the healthcare providers in the region to discuss a testing protocol, and he'll bring that back to us later on with no financial piece attached to it. Right?
No,
No.
that is not the motion. The motion is to work with Pima County and the University of Arizona to
Initiate
talk about the testing strategy and to talk about long-term planning for this. But the first step is to initiate a conversation with Pima County and the University of Arizona so that we could put forward a testing strategy as soon as possible. And I believe Council Member Lee had mentioned a certain amount, maybe $3 million, but that is something that the city manager will come back to us with.
Why would you not include El Rio and the hospitals and the clinics?
They're part of the motion. That's the health care people.
That's what I just said.
I know, that's in the motion. That's in the original motion.
Mm-hmm. It's working. It's working with of course the healthcare providers that we have in hand, but they're not all going to sit around and make a decision as to how the testing program in the city of Tucson is going to proceed.
If we can get our hands on the tests in the lab with the capacity to do the test and do the test, why are we going to wait till June 9th to start testing, Steve?
I'm not saying that. You could stand it up tomorrow if you throw some money at one of the hospitals.
I'm totally, that's part of the motion. That's part of the motion.
That is a part of the motion.
Absolutely.
You're saying it is, and Rahina's saying it isn't.
There is a vote that there's a roll call that's going on, and we need to proceed.
I want to know what the motion is, because you're saying one thing and Paul's saying another thing.
Paul, can you reread your motion, please?
I move that the city manager coordinate with the University of Arizona, Pima County Health Department, and local healthcare providers to initiate a testing program, starting with city employees and transitioning to the public. The underlying goal is to test 1,000 people a day for the next 45 days. That's it. And then in our discussion, I said, let's cap it. And we said, we don't want to do a cap because we don't know how much it's going to cost. So I said, well, try not to spend more than about $3 million by June 9th. I mean, but I trust that the manager's going to use good judgment and not allow us to be completely ripped off.
Okay, Vice Mayor. Okay, Vice Mayor, we're on roll call. Can we continue with the roll call?
Councilmember Kozaczek.
With the clarification that Paul just made that we're including the entire healthcare community in the region, I'll say yes.
Mayor Romero.
Aye. All righty. The next part of the conversation for COVID-19, the federal updates, and we have Andrew Greenhill on the line that will give us federal updates.
Sure. Well, thank you, Honorable Mayor and members of the council. I'll do a couple of things today. First, I'll give a quick overview or update of the CARES Act dollars. There really isn't too much different from the last meeting, but I'll cover that. And then secondly, I'll also give an overview of the HEROES Act, which is the bill that Congress passed on Friday that includes a number of provisions that are of interest to Mayor and Council. So with that, here's the updated chart of CARES Act allocations. You've seen this before. Again, the updates from the previous meeting are in yellow. Again, I won't go through too many of these because following me, the city manager's staff will go over some of the intended or ideas of how to use these dollars. But as you can see, there's been a lot of work on the staff side looking at how we can use those dollars. The one new allocation is right here that we've received since the last council meeting. It's an allocation in the amount of $587,000. It's towards the Housing Choice Voucher Program. It can provide for administration and facilities towards that program. Again, we're grateful to Congress and our congressional delegation for that allocation. Again, other than that, that's really the only new allocation since the last meeting, and you can see here the updated total amount that we've received from the CARES Act, over $147 million. With that, I will turn to the next act. So as you know, the need across the country continues to grow with unemployment and the needs in state and local government to cover their shortfalls. With that, the House of Representatives proposed and then voted last Friday on a new relief act. It's called the HEROES Act. It's otherwise known as the CARES 2 Act, but it's the follow-up to the CARES Act that was signed into law March 27th. As you can see, it was approved by the House by a vote of 208 to 199 this past Friday. And I can tell you that a number of the provisions in the bill are very much aligned with mayor and council priorities. So I've listed some of those here. First off, local government assistance. There's over $375 billion in the bill for local governments, and that's separate from $500 billion separately that would go to the states. And yes, those funds can be used for revenue replacement. The bill also provides for retroactive flexibility with those CRF dollars, so that $95 million we've received, it would allow us to use those dollars for revenue replacement. It provides for a HEROES fund, like a hazard pay fund, $200 billion that would provide that pandemic premium pay, and I know this has been important to mayor and council. Housing assistance, as you can see, a number of funds, $5 billion for CDBG, $11.5 billion for ESG grants, and $100 billion for emergency rental assistance, $150 million for HOPWA, and then there are other housing assistance programs as well. $10 billion for SNAP, otherwise known as the Supplemental Nutrition Assistance Program or food stamps, as well as another $150 million to assist food banks around the nation. Then there's utility assistance, including a new assistance program for water and wastewater bills, $1.5 billion, as well as another $1.5 billion for LIHEAP, which is the existing utility assistance program, but it only covers power bills, electric and gas. There's $75 billion for testing and contact tracing. There's also another $7 billion for child care grants. Those would go to states and ultimately from states down to child care providers. There's another $15 billion for transit operations. I'd note that with the additional funds, there's also some new requirements, including the requirement for transit riders to wear masks or face coverings if they are utilizing transit, as well as some requirements of the transit providers to provide sanitation and protection for customer-facing employees. There's $300 million for public safety grants, as well as other public safety grants in the bill. The Lifeline program, this is of interest to I know the mayor and certainly Councilmember Durham's office, and I know with the Pima Council on Aging, they were very concerned to make sure that there was enough support in this program to allow for people to have more minutes and data, and the bill does provide for unlimited minutes and data through the pandemic emergency. And then two last items, there's $25 billion for the Postal Service and more flexible terms on the $10 billion in borrowing authority that it received in the CARES Act. And then finally, $3.6 billion for a national vote by mail program, which includes a requirement of 15-day minimum early voting. It also provides for online voter registration nationwide. So that, and of course, there's much else in the bill. The bill passed the House, and then now we're at the point where all attention goes to the Senate. The Senate Majority Leader McConnell has said that he does not plan to bring the HEROES Act to the floor, but at the same time, there are some other bills that would also provide some either flexibility or new funding to state and local governments. As you can see here, there are a couple of bills that are majority Republican bills in the Senate, one sponsored by Senator Kennedy of Louisiana, another by Senator Sullivan of Alaska. You can see that our Senator McSally, is a co-sponsor on both bills. These bills would not provide additional funding, but they would give us that retroactive flexibility on the CARES Act dollars that we've been seeking. So we appreciate that. The bills do have some differences, and I know this came up in the previous discussion. The first bill provides for us to be able to use those funds past December 31st, 2020. The second bill here does not. And then finally, one bill that the text of which was released last night. This is a bipartisan bill co-sponsored by Senator Menendez of New Jersey and Senator Cassidy of Louisiana, among others. It provides $500 billion across the country to states and local governments. It comes up with a new formula on how those dollars would be distributed based on population size, but also the number of COVID cases in a certain location, and then also looking specifically at state revenue losses. Too soon to say what this would mean bottom line for the city of Tucson or Pima County, but this is another bill, though, that the Senate has now introduced and will consider. So with that, I'm happy to answer any questions or turn it back over to city staff.
Thank you, Andrew. Are there any questions from my colleagues on the council? We're looking in the queue to see who's jumping in. Alrighty. If there are no questions, then thank you so much, Andrew. Really appreciate all the work and helping us, especially with sending those letters to our congressional delegation in terms of what mayor and council priorities are and our support for revenue replacement for the city of Tucson. And plus, right, especially with the HEROES Act, it is very thorough act. Thank you, Andrew. If there are no questions, we move to the next item under this particular agenda, which is the reopening plan. I just wanted to give the floor over to the city manager and thank you, Mr. City Manager, for really putting a thoughtful plan together. I know it has a lot of details and you wanted an opportunity to talk about it with my colleagues on the council. So the floor is yours.
Thank you, Mayor and Council. Appreciate the opportunity. So what I provided you was just what I'll call the draft reopening plan. We've been working on it. Mayor, you had established June 8th as our, we'll call it first phase opening. There were a couple things I wanted to point out and maybe talk through with you and get your thoughts. One is the temperature checks. That is something that we keep hearing interest in. I can tell you that we've got ideas there in terms of how to accomplish that. It won't be perfect in every area, but generally speaking, we're thinking that we would be leaning towards that. One of the concerns that we have on that is the temperature outside, the ambient air temperature will be rising, and so we've got to account for that. I bring it up because I know that there's been some interest, and I've heard from some of you as to what your thoughts are, and I'm open to those conversations. Keep in mind, it's just not as simple as everybody that walks in the door, we take their temperature and then have them stand aside. It's a little more complex than that. However, there are ways to do it. We're certainly willing to have that discussion around it. We have ordered several thermometers, including a couple of full body scans that we'll be deploying and utilizing in some areas. One of the biggest challenges are the logistics of multiple entry points and how we deal with that. Some of the conversations we've had has been we established a public entrance and an employee entrance, so that's been part of the conversation around that. With regard to the face coverings, Councilmember Kozaczek mentioned that earlier. Thought there is that all employees and public would be required to wear face coverings when they're in public spaces within the buildings, and that would include lobbies, foyers, those kinds of things, as well as when they're meeting in conference rooms, those kinds of things. The idea there is that if you are in your own office or in your own workspace, you can remove your face covering as an employee. If a member of the public comes in and does not have one, we would provide one for them. That's the plan that we're going down at this point. Next item, social distancing. We will implement a 6-foot social distancing. Again, that's in all areas as best we can. Obviously, in some areas it may be very difficult, such as elevators. We'll have to think through how to deal with that, but that is something that we're working through. Wanted to also mention our facility improvements. We are embarking on a lot of sneeze guards and a variety of, we'll call it signage and other improvements or modifications to the facilities, and that's across the board. We are working through everything from cleaning our HVAC ducts to making sure that there's adequate signage and markings for people that are queuing for city services. I wanted to spend a little bit of time talking about remote work or teleworking. Again, our world changed a few weeks ago. My expectation is that we would continue with a lot of teleworking pretty much across the board in those areas that can. I don't think it will be 100% teleworking, but I do think that there will be a lot of folks that are able to, and we will encourage them to do that. We have begun work on an AD that is updated. The AD that was in place previous to the pandemic, in my opinion, needed some work. So we're going through that. I've been working with Mike Rankin and his staff to develop the criteria. Some of the things that I listed in the note that are important, I will encourage those that fall into those 4 categories to telework. We'll provide every opportunity for them to do so. The other question I'm asked continuously is for how long? And my response has been for the foreseeable future. I don't see us going back to the business that we had a few weeks ago or a couple of months ago now for several months. Based on feedback that I've received, I think we can continue down the path of virtual city services in most areas. I know that we have really changed the way we do business, particularly in interacting with the public, those kinds of things. So again, that was a snapshot. I didn't intend for you to have to read all of it. And again, I apologize. I thought it would be of value to give it to you, at least to let you know what we're thinking. We do have some time. We are going to get together next week. Mayor, I understand that you'd like to have a special meeting on the 27th. We can talk about it in more detail at that time. I welcome your feedback individually or as a group. We're moving down the path of June 8th is what I'm calling our gentle or soft opening, where we'll have some staff coming back into the offices, others will not, and then what you see in the plan, we've got it staggered basically on a 30-month or 30-day period. So, Mayor, happy to answer any questions.
Thank you, Michael. Very helpful. Putting your thoughts on paper, things that you and I have been talking about for weeks. I wanted to take this time just so that my colleagues on the council know that in the proclamation extension that I signed on Friday, the input of Mr. Ortega and Mr. Rankin were very, very important to put that proclamation and decide on the June 8th reopening, phase 1 reopening of the city of Tucson and its buildings. Part of the reason that we selected June 8th as a reopening timeframe was because in our conversations, the city manager and I, with Chuck Huckleberry and Dr. Francisco Garcia from the county, is that in the modeling that they have been studying, that Pima County Health Department have been studying, they show the end of May, the first week of June as a time frame when COVID-19 positive cases come down. And so with that information from the Pima County Health Department, we selected June 8th as a soft opening, as Mr. Ortega said, but also as a phase 1. In this phase 1, we wanted to make sure that our employees understood that if they are 65 and older with autoimmune deficiencies, and they have been working, teleworking from home, that they can continue working from home. Those with existing health conditions that have been successfully telecommuting, that they can continue telecommuting. Those employees who live with vulnerable family members that have existing health conditions, or employees with children that do not have access to health care, that have been successfully telecommuting and teleworking, that they continue working remotely. And so I just wanted to reiterate that for our colleagues. Those are the conversations that we have been having. And I really appreciate you putting your reopening plans on paper. Mr. Ortega, you and I have been talking about these reopening plans for the past 4 weeks. And so I'm happy to be able to see it on paper. I know that Councilmember Durham would like to speak and has some thoughts about how to continue making sure that the public and our employees stay safe. So, Councilmember Durham. You might be muted.
I've got to unmute my microphone. How is the city proceeding to allowing restaurants to use sidewalks, easements, parking lots, and other areas as temporary seating to promote social distancing? I don't know who that.
Mayor, Councilmember Durham, I had that as a separate item under the COVID update, but I can just tell you that we are working on an administrative approval for that expansion of premises of restaurants to include their parking lots and in some instances the public right-of-way, based on keeping a clear area for ADA accessibility, those kinds of things. We do not have that finalized. I saw a draft yesterday. I'm expecting that we'll have that finalized here in the next day or so. We have been working with the chamber and some of our partners to make sure that they're well-versed in it, and we're also taking input from them as well as others on what that might look like.
So with regard to City of Tucson operations, broadly, I have concerns about employees being adequately protected. I think having the necessary PPE, adjusted work duties, and testing available will be important. We do not currently have all of the PPE we need. How are we remedying this?
Mayor, Councilmember Durham, our logistics team through the EOC has been ordering and obtaining PPE. We believe we have a good stock now. We have about 3 weeks which to stock up even more to ensure that we have adequate PPE both for the staff and for the public. We would provide that to the public, mainly face coverings that don't have them if they're coming into a city facility.
So, next point, I'm concerned about whether and how we should continue the KidCo program, and how as a city we can make sure our employees who need to return to the field are able to access safe childcare. Can we put out a survey to employees so we know what their childcare needs are? What's our plan for KidCo, and can we look to potential adaptations based on responses from employees and what we see from the childcare industry?
Mayor, Councilmember Durham, those are two different issues, certainly related, but different. First is the child care. I have asked the staff to survey employees to determine the magnitude of that issue or that request for us. I can tell you that early on, we had worked with our partners at the YMCA and also Boys and Girls Club to provide childcare for first responders, and we got very little participation in that. We will now expand that to see what that need might be. Keep in mind that the licensing requirements for childcare are different than recreation programs, so we're going to work through those nuances to ensure that we're in compliance. So we may not offer, quote, childcare but we can do open recreation, those kinds of things that we're licensed to do. With regard to the KidCo program specifically, we are looking at what that, we'll call it recreated KidCo could look like, practicing social distancing, et cetera, up to and including expanding the area in which it is contained. Clearly, when you have 30 participants in a cafeteria small room, that's not going to work. So we may need 2 or 3 rooms, which increases the cost of staffing, et cetera. So we're going through that exercise now to determine what KidCo could look like going forward.
Next question. Are we planning on to have the mayor and council meeting on June 9th in the chambers? And how many members of the public could be in the chamber while maintaining the social distancing recommendations?
Mayor, do you want me to respond to that, or Roger?
I'm sorry. What was the question, Councilmember Durham?
So are we planning to have the mayor and council meeting on June 9th in the chambers, and how many members of the public could be in the chamber while maintaining social distancing recommendations?
Well, I think that we need the recommendations from our city clerk so that he can put a plan together, and whether June 9th is going to be appropriate to have that meeting. So in other words, we have not discussed that, Councilmember Durham, but are open for discussion and input from my colleagues on the council.
Okay, so what's the answer?
I believe that the city clerk will be communicating with the full mayor and council with his plans for the June 9th meeting.
Okay.
So in other words, to be determined.
So I've got some a question and a motion regarding item 7. I'm sorry. Tucson, I see in the coronavirus relief fund memo the inclusion of community testing and tracing as an option under the community support section. Is this where the dollars would come from to fund this?
Yes, I believe that was the intention, right, Mr. Ortega?
Yes, ma'am.
So how would the community COT employees be tested? Is this the idea to do testing in a regular frequency, or only those who are symptomatic?
Mayor, per the previous motion that was approved by the council, what I will do is explore developing a partnership with the county and the healthcare providers with the point of clarification there towards the end. What I'll try to do is figure out how best to use the existing systems that are out there for testing so that we can move this quickly. That would include the initial testing as well as potential follow-ups. Once I have a handle on what those costs are and what that logistics looks like, or those logistics look like, then I'll bring that back. I may just inform you, depends on what the timing for that is as to further action from the council, or we may just be able to continue doing it.
So I would like to see every City of Tucson employee to have access to testing, whether they are symptomatic or not.
And I believe, Councilmember Durham, that was the piece of the conversation where Vice Mayor and I gave direction previously, and of course it passed unanimously to the city manager to start with city employees that work in the front lines, and then every city employee, and then hopefully also include their families. So I believe that's the directive that was given with Vice Mayor's motion.
So the city of Tucson employees have access to testing whether they are symptomatic or not?
That is the spirit of.
Okay.
Any other questions, Councilmember Durham?
No.
Okay. Alrighty. Any others on the queue? Steve, I believe Councilmember Kozachik is on the queue.
A few things. First of all, we have another agenda item about reopening the city, but you're talking about it now. Why don't we just combine them and have that conversation now so we don't have a redundant one later? Does that work for you?
I'm sorry, Councilmember. We are. I think they're spilling into each other, but I don't know exactly what you wanted to speak in that particular item. It's item 8, and I believe your staff wanted it to be a separate item, not part of the COVID-19 item. So.
But it seems to fit because we brought up because Mike sent this, Ortega sent this last night, and it's about reopening the city. So it seems to fit. First of all, somebody made a mention of a special meeting on the 27th. Are we thinking of that? Or?
We are thinking of that only because we want to not pile up so much on the 2 meetings per month that we've been having, and there are some unfinished items that we have to do sooner rather than later. And so the idea, the concept of a 27th meeting has been thrown out. Yes.
All right. Before we leave today, maybe we should all look at our calendars and figure that one out. Mike Ortega, you sent this thing out last night on the city reopening plans under the parks for June 8th. You don't specifically call out playgrounds. You call out ramadas, but not playgrounds. Was that intended to be included?
Mayor, Councilmember Kozachik, it is not intended to be included, and part of that is want to make sure that we're able to sanitize them appropriately. One of the concerns, quite frankly, is the lack of sanitizing agents and so forth that we had before. So we will open the restrooms first, really get a handle on that, then we'll look at the playgrounds down the road.
Okay, they didn't appear anywhere in the memo, so I just want to clarify that.
Yes, sir.
Paul asked about extension of premises. First of all, the state preempts us on a lot of this stuff, I understand, but during the Zoom meeting held with the business community, they also brought that up, the outdoor seating, and the outdoor seating is included in what the county put out that we, through Rena's proclamation, signed on to. And so I would like us to, first of all, it's more than just ADA. We also have to make sure that the size of the group is taken into consideration. Within the last couple of days, I've gotten some requests from businesses to expand into parking lots. And when asked what they had in mind, they're talking about entertainment venues for up to 120 and seating capacity for over 100. So the optics of that are pretty challenging, especially given all of the the numbers of people that we're trying to avoid getting together. So I want that size of the group to be a factor as well. But with that in mind, I'd also like us to maybe think bigger, and that is to talk about shutting down some streets, Congress or Scott or 4th Avenue for a while, to let businesses do a car-free, put tents up and start thinking outside the box a little bit while instead of trying to cram some of this stuff into parking lots or onto sidewalks. There was very little guidance given on performance venues. Those are going to be a challenge. I haven't had a chance to really digest what you sent out last night, Mike, but I don't think it's incorporated there. I think, Rahina, you included something of that in the proclamation about performance venues, and so those are going to be a challenge from a social distancing standpoint.
Yeah, council member, I did. I included that we follow that guidelines that Pima County Health Department has put in front of us, and they have guidelines for restaurants and bars and entertainment venues and hotels and their pools and all that. So they've done the work. I've been participating in the Pima County's Back to Business Steering Committee, and so I feel that Pima County has really put a lot of thought into their work and how to give guidance to reopen safely for all of these businesses out there. Even though they're getting 1487 claim from some Pima County legislators, I really support their work and their thoughtfulness on giving guidelines to entertainment venues. But I agree that there's the answers are not completely there, and we should see these guidelines as a living document, really, because none of us have all of the answers immediately. And so right. I know that Pima County was going to reevaluate some of that language already at their meeting today.
Yeah, and I agree with that. So we held what does reopening the city look like Zoom with healthcare providers as well. All of them said that we can lose all the gains that we've had if we don't reopen conservatively. So I really embraced the notion of let's just get this right, not get this fast. None of them supported ending stay at home. All of them have concerns about the supply chain for PPE. And Bob England mentioned earlier that we can ask for all the testing we want, but there is a supply chain question, and they are really concerned about those supply chains if we get a resurgence. So those are concerns that they expressed. One of the things that they also brought up that I would like us to consider is a wide media educational blitz. Just because Ducey says it's okay to fling the doors open doesn't mean everything is fine. Media blitz on wearing masks while in public, on the whole surface transmission. We're getting caught up in the masks thing, but you can still transmit the virus by contact on surfaces, door handles, and things like that. Media on vulnerable populations. Several of us have mentioned and you mentioned it in your proclamation, the assisted living facilities and the congregate settings. Those are really important. We could use our Channel 12 staff to push it out, but beyond City of Tucson TV to 4, 9, 13, the Star, make sure that what we're producing gets out well beyond the just Channel 12. There is concern about swimming pools and things, but I would like us to talk about opening Edith Ball, the senior aquatic therapy center, for by appointment only with a therapist on your doctor's orders kinds of things, and show that we can do this safely. But osteoporosis is a big deal among the senior community, and we ought to not just shutter that facility indefinitely. It's fundamentally different than opening up a community pool for lap swim. Also like us to look at opening these boards, committees, and commissions by Zoom. I know there's a conversation about certain BCCs, but they're ready to meet. I was stopped actually in the street walking into work today by a guy who's on the Park Tucson Commission, and I said, how would you guys feel about doing it by Zoom? He said, we just want to meet. So that's something that certainly we could be able to do within the guidelines of the CDC recommendations. That's the kind of thing that I'm hearing from the community, our constituents. We have I did, by the way, just all of you have been in the Ward 6 office. I did a walkthrough of our community room and our 2 meeting rooms and did the whole social distance thing. We've had 50 or 60 people in those rooms. We're going to be down to 13 to 15 maximum in all of them now, and I'll be sending that out to the groups that have been using the meeting rooms. That's it's gonna really be a change for a lot of their thinking. But with the social distance, that's going to be the new reality for a while. Thanks.
Mayor.
So, yes, Mr. Ortega.
Mayor, a couple of thoughts. Thank you, Councilmember. Appreciate your comments. Well, one of the things that I think is important for me to convey to the council and to the employees, if we get into this and we're into the latter part of June and we don't have adequate PPE or just pick it, right? We see resurgence, there's issues of concerns. I'll shut it down again and we'll go back to what we're doing, virtual city service. And I say that to you because I want it clear that, you know, we are going to do this very deliberately. We have been very deliberate in our waiting for this long. And as Councilman Kozachik mentioned, we don't want to undo the gains. So if I see that we are struggling on any of those fronts, then I'll make the call and we'll move that forward. The other thing I wanted to suggest, and if we have time, Mayor, I'd like to talk a little bit later about an idea of a we'll call it a community-wide cleanup, which goes in line with what Councilmember Kozachik mentioned in terms of potentially shutting down streets and really embracing the idea of opportunity that this brings with it. I know that part of our conversation internally has been how do we facilitate the venues and all things that you all have talked about. To Councilmember's point about the size of groups, we'll work on that. I'm not sure how to do that exactly. My gut is that in talking to our legal counsel, maybe there's an opportunity for us to grant an expansion with a limited number of people, something like that. We'll have to work through those logistics. With regard to the BCCs, I think that we have seen now that we can accomplish it, obviously, except for maybe mayor and council on occasion, but it looks like we're able to do most of our business by Zoom or other mechanisms. So I think there is an opportunity for us to think about that sooner rather than later. Thank you, Mayor.
Yes, thank you, Mr. Ortega. We have on the queue, we have Vice Mayor Cunningham, and then Councilmember Durham, and then Councilmember Lee. Vice Mayor?
Yeah, the first piece I wanted to talk about was wash in, wash out. So the way I understand it is that you can sanitize when you walk in, before you walk in, and then sanitize when you walk out. You, one, lower your risk of shedding while you're inside, and two, if you pick anything up inside, you're able to wash it off. So wash in, wash out is a big piece of this, and it's something that we should probably implement in every building all the time, not just during the pandemic. So I'd love us to be very aggressive in trying to have some type of wash out station at every facility. I think it is realistic, and it can kind of set an example for what all other facilities would like to have. Two is I'd like to talk about tying some of this into our testing. I'd like to put some benchmarks in there where we have testing in place for employees before we open. And I think that marries into the discussion we just had. But if we're going to reopen June 8th and no employees have been tested and we don't have access for tests for our employees, then why are we going to reopen? We just went through the entire discussion about wanting to reopen and possibly even having a live council meeting on June 9th. And if we don't have proper testing in place, that's moot. So the testing piece is a part of this. The third thing I want to talk about is a constituent issue that has been brought up to me several times. how exactly are we doing the sports field situation? I know we're not allowing reservations of sports fields, but is it like if 18 people want to show up and play a game of baseball, are they allowed? If you want to show up with your friends' kids and your cousins' kids and kind of organize a pickup game for them, and whether it's soccer, football, or basketball, are they allowed? I got to tell you, as somebody who lived his whole life doing sports, being out of sports for 2-3 months can be very numbing to the soul. And we've got to hopefully find a way that people can, who used to get their exercise for athletics, can get that. And so I don't want to be over aggressive about that, but at the same time, what I don't want to have is a situation of people are kind of freelancing and going by the first come, first serve rule of athletic fields. Are we going to permit that, or are we going to shut them down? I guess that's a question for the attorney. The next question I had about was playgrounds, and I'm kind of the idea that with playgrounds, if we can open bathrooms, we can probably figure out a way to open playgrounds with wash in, wash out. The next one is I got a couple of inquiries about the rec centers. Again, a lot of people are requesting, well, a couple people have been requesting it, and I'm thinking to myself, I'm really weary of opening up some of our senior centers and stuff like that. I'm very, very worried. So I think we kind of take that as it comes. And then I also got a couple questions from restaurants about some of the requirements that not allow people to sit at the bar, but they're 10 feet away. And I think I've already spoken with the city attorney on those things. So those are kind of some of the thoughts. I guess I'm going to ask about the field question. The main three are the field, the wash in, wash out, and the testing. I want to have those three. Well, I want to have the testing and wash in, wash out in place before we reopen. And then I want to talk about fields really quick. I just kind of want to get, what is our interpretation on fields? Can you organize soccer or what?
Vice Mayor, I have, I know that the city manager is working with his departments on all of these logistics, because there's a lot of questions, and of course, those same questions are coming from the community as well as the council members. And I just don't want to get into the weeds of all these details. I'd much rather we continue with the items on the agenda, and then maybe the city manager can put a frequently asked questions paper together, so that just as you have questions, I imagine the community does as well. And so in the interest of time, because this item is really thick, we still have to talk about the budget, the housing department. There's a lot of very important items on the agenda.
I can get my offline. I'm good.
Yeah, let's get them offline, and there's also an opportunity to put a FAQ paper together for the city manager to share, not just with mayor and council, but the community. We do have Paul Durham on the queue, and then council member Lee.
So I think it's very important that the city set a positive example and do what we can to remove barriers for our communities to follow social distancing policies. I think that it needs to include a broad public messaging campaign involving all City of Tucson PIOs and social media accounts, as well as apps like Nextdoor. We must take advantage of every opportunity to communicate these recommendations. Positive peer pressure can be a valuable tool. So these, including, for instance, images of public city leadership featuring wearing masks, etc., can set a positive example. I also think we need to make sure that every household has access to masks. I believe that we are, mayor and council is well positioned to make these available. I move that the city of Tucson utilize all digital communications channels available, including as well as spaces within our facilities to implement a public messaging campaign promoting social distancing, and that the mayor and council, in participation with the executive leadership team, acquire and distribute 50,000 masks to community members.
There is a motion. Is there a second?
I think the spirit of it is fine, but I don't think we set quantities. PPE is in short supply right now, and you can use a bandana as a mask for being out in public. I agree that the importance of messaging. I said that in my comments as well, but I'm not sure that. Let's work towards that. I mean, and Regina, your office was putting together something about masks already with the 7 of us or something. So let's do it, but we can't be setting quantities for PPE, especially with them being so backlogged.
Thank you, Councilmember. Is there a second to Councilmember Durham's motion?
I'd like to see if you would have a friendly amendment of not adding the mask in there, but doing the media campaigning and getting that out is what I liked about what Paul's motion was. And I'll second that if the councilman could retract from the mask issue.
Yeah, would you consider an amendment to change cloth masks to face coverings?
Yeah. Any kind of protection. Yeah.
I do. I like the idea, and I'll tell you why I like the idea, Councilmember Fimbres and Durham. In order to be able to have a successful campaign, which I love, we've already started, but I think we need to double down on the effort of using our public information office for pushing the idea of social distancing and face coverings, is because it really is not an expensive proposition, and whether it's a cloth mask or a bandana that the city of Tucson can contribute, I think that it's a great idea. So maybe the amount, you said 50,000, Councilmember Durham, but I like 10,000 for every ward, so 60,000. But it's entirely up to the council.
Mayor.
Yes.
Mayor, if I might just add, our plan is to provide face coverings to you for issuance to the public when they come in to meet with you. So that's going to be part of what we're doing. I'm a little nervous about 10,000. That's pretty aggressive, but certainly one of the things that we'll observe very quickly is how many masks you're giving out in your various ward offices. But it is our intention to provide you with adequate, I'll use that term loosely, adequate mask or face covering for those that come into your office. And we can continue down the path of trying to obtain more so that as you see a need within your particular wards, then you're able to provide that as a resource. So I just throw that out as a way. We'll certainly work towards whatever the council directs, but it is our intention to do that for you already.
All right, perfect. So there's a motion and a second. Are you both the motion maker and the second? Are you both comfortable?
Would Mr. Ortega be happy with distribute face coverings as needed?
Mayor, Councilmember Durham, I'm comfortable with that. Obviously, when you run out or we run out, then there's no more right then. We'll have to get more and replenish. But certainly, my expectation is that you would be given a supply, if you will, of masks that you can give to folks that are meeting with you, as well as those that you deem appropriate and see fit within your wards.
Alrighty,
So Paul, can you repeat the motion now with your amendment?
Yeah, I move that the city of Tucson utilize all digital communications channels available, as well as spaces within our facilities, to implement a public messaging campaign promoting social distancing, and that the mayor and council, in participation with the executive leadership team, acquire and distribute face coverings as needed to community members.
Okay, I'll second that.
There's a motion and a second. Roll call.
Mick Santa Cruz,
Aye.
Mr. Cunningham,
Aye.
Mr. Durham,
Aye.
Mrs. Lee,
Aye.
Mr. Fimris,
I think he's muted.
okay.
Aye.
Mr. Kozaczek.
Aye.
Mayor Romero.
Aye. Alrighty. Now we have Councilmember Lee and then Councilmember Pima.
Thank you. I will be brief. Just relative to the reopening plan that Mr. Ortega sent, I feel that June 8th could potentially be aggressive, just knowing how many things may need to be done to retrofit buildings. So I just wanted to reinforce my understanding that we have to be flexible in this, because there's going to be a lot of demand for those items, as well as PPE. Also, to echo what some of my colleagues have said by leading by example, regarding tech, we've spent a lot of money, we've invested a lot of money in enabling our workforce to work remotely. So I also want to encourage us to continue to utilize that this time as an opportunity to reinvent the way that we approach work. I think it is a time to do that and use technology as much as possible and continue to work remotely to keep our workforce safe and to do things a little bit differently. So just want to throw that out there. And we did go into the agenda item that Councilmember Kozaczek and Durham and I had, which has changed dramatically since May 1st. So the only thoughts that I had on that item, since we did go into that, are really for Mr. Rankin. And I don't expect you to have an answer on this today, but really the thought process that I have as we look long term through the rest of the year and into next year before there's a vaccination that is widely available is how might cities, just with this, for lack of a better word, this power struggle between the governor's office and cities and counties across the state, as spikes happen, how might the city of Tucson be able to address our autonomy in dealing with those spikes legally and within our city charter? So that's just really where my head went with looking at reopening the city. So that's really the only item in my mind that I had open relative to that I would like us to explore. So that's all I have, Mayor.
And Councilmember Lee, Mayor, members of the council, I will be happy to address that as we move forward. I think you know that there has been a 1487 complaint filed with the Attorney General's office relating to Pima County's attempts to impose regulations on reopened restaurants and other facilities. And the outcome of that could also be instructive to the very question that you just raised.
Yeah, great questions, and I really like the concept of really rethinking what the new normal is, and even how mayor and council really meet, and be able to have that IT, that equipment that will allow, if any of the council members feels as though they might rather meet online, as we have been doing, because we don't have a vaccine, because some of us have children or parents that live with us. I think we have to reimagine how we do business in the city of Tucson, including mayor and council. I believe Councilmember Fimbres has a couple of questions.
Yes, I just wanted to include in there the making sure that the council chamber is ready for, and we practice the social distancing when we're back there. that we have it, and then also that if we have to go online again, that the IT system is set up that's needed, because we had a lot of problems when people were in the chamber. I want to make sure that's rectified. The other question I have for ward offices, we have the fire department and we have people that have done CPR certification and training, which is a need right now. But I want to know, I told them not till June 8th that we're bringing this back. So is that okay as a thought? Because they need to get some more people certified in CPR training. We also have the census that wants to come in and utilize our office too. Have been utilizing offices for some things. So those are things we have to look at. The other question is, with Ms. Ortega, is when we're opening up things, we need to look at guidelines for the nonprofits, because a lot of them use the events right now for graduation events and parties and steak fries and stuff like that to raise money to pay for their property taxes. And a lot of those mom and pop, the American Legion, the DAV, the VFW, and the other one is the Railroad Museum that's right up on Tools. So those are things we need to make sure are considered when we're talking about moving this agenda, this item. Thank you.
Absolutely. A couple of things that I wanted to bring attention to in this item in terms of reopening. We also have to make sure that council offices and other offices that are visited by the public, or that there's community use, face-to-face contact, we need to make sure that some council offices that don't have sneeze guards are retrofitted, and then that we do the same thing with our transit system, our SunTrans system, which some buses have added sneeze guards and protective plastic for the drivers, but not all have. So I know that we have $44 million of FTA funds specifically for our transit system. Let's make sure that we are taking advantage of those funds from the CARES Act to retrofit our buses. Also, the ADA accessibility in some of those buses, I think that drivers still have to help many wheelchair-bound bus riders, and really have to get close to helping them. There are pickups for wheelchairs that the individual can lock themselves in on their own, and they can lock it up and enter the transit or the bus on their own. So when we start looking at retrofitting buildings and getting ourselves ready to reopen, we have to think about those issues and using the CARES Act fund or the FTA funds to get those things done. Before we move on to the next conversation under the COVID-19 item, which is the CARES funding memo, I do want to bring your attention to one of the items that I talked with the city manager and the city attorney about, and gave additional direction on my proclamation, which was to continue the moratorium on Tucson water disconnects and late fees, and also to continue the moratorium on evictions at city-owned facilities through the end of June. Both of those are through the end of June. So I just wanted to call attention to that piece. We don't have any outstanding motions on the floor, do we? Okay, we're ready to go on to the next piece, which is the CARES funding memo. I understand that the city manager submitted to mayor and council a memo that kind of gives some definition to the CARES Act funding, and I believe that he kind of leaves some flexibility in there that I think is appropriate for mayor and council to speak about. And so what I'd like to do in this particular item, I know that Councilmember Santa Cruz had requested some time to put some ideas on the table. So if you don't mind, Mr. Ortega, I'm going to open up the CARES Act funding with Councilmember Santa Cruz so that she can expand on her thoughts that she wanted to present to you and to my colleagues on the council. And then we can take the conversation from there. Councilmember Santa Cruz?
Which item is this?
This is under the COVID-19 item. We're still in the same item, number 7. But
Okay.
we had outlined the item with the different pieces of that particular conversation. The city manager wanted to make sure that we talked about the CARES funding memo that he included with his budget under this particular item. So, yes.
Mayor, just to help out, so I had sent out dated May 12th a memorandum. It's titled Coronavirus Relief Fund. And then I also attached it to the budget memo just so it'd be in one spot. So that's the memo I think that we're going to be talking about now.
Okay, Councilmember Santa Cruz, are you ready?
I'm ready.
All righty.
Thank you, Madam Mayor. And I also wanted to thank Mike, our city manager, for his recommendations of how to spend our CARES Act funds. I believe that we have one of the best city managers in the country, as demonstrated by his savviness with numbers and his passion for having a balanced budget. At the last Mayor and Council meeting, we affirmed our commitment to an equitable response and allocation of how we distribute the CARES Act funds. On the back end, I know that city staff is moving forward with the mechanism to track how we are distributing the funds and partnering with organizations that are going to ensure that we're serving the most vulnerable in our community. But I also think that on the front end, we need a budget that has this equity piece at the center. So I feel like as the elected policy makers, we have a responsibility for the human need and community impact of how we allocate the funds and how we balance our budget, and that these funds present a unique opportunity to how we respond to community need during this pandemic. I understand that future federal funds might be distributed at a later time, but most likely will not have the flexibility that we see in the CARES funds. So with that in mind, I wanted us to consider having a mayor and council strategic plan for how we allocate CARES Act funds. And I think this goes back to what Council Member Kozaczek was mentioning earlier about how do we not just are setting pots of money aside, but that we have a cohesive plan with mayor and council input. So I want to do the screen share, and I'm not sure how, it says I need permission to share. Who needs to give me permission to share my screen?
City Clerk?
Probably the meeting host, which I think is Rogers.
I believe it's a City Clerk. Hello? Roger?
Madam Mayor, I'm trying to figure out what the issue is.
Okay. Can you try it again, council member? See if you can go in.
Okay. All right. It looks like it wants to let me now. Can y'all see it? No?
Not yet.
Mayor, Councilmember Santa Cruz, we saw it for a brief instant. So just click on the one, so go to the share button and then click on the screen you want to share. It showed up for a quick instant, but then it left, so.
I think you have to open the document and
Yeah,
then
document
click
has to be open in your desktop, on your desktop.
The screens kind of move around quickly. All right, okay. There we go. Can y'all see it now?
Yes.
Okay, so I have been seeing what the city of Phoenix and their mayor and council have been putting together as far as how they're using their CARES Act funds, and they've come up with a strategic plan to give direction to their city manager on how we can lay out an equitable budget framework for how we're using and spending the funds. So I wanted to use this time as an opportunity to talk to my colleagues on the council what we've been hearing and some of the work that we've been focused on with our community, and how we can think about distributing the funds into these three categories of having our community investment and support, allocating funds to continue our city operations and services, and then putting a more significant portion into reserves, so that 2 to 3 months from now, as we see some of the needs that we might not have predicted before, that we're thinking about, being able to have the flexibility to pivot in whatever direction we need to go 2 to 3 months from now. So I wanted to put this on the table, like I said, to hear from folks, so that I know, earlier we were talking about the community testing, and so really having some foresight on how we want to see this breakdown happen, so that we're not piecemealing these funds together, but kind of having an overall plan from the get-go. And so what you see on the right, well, I guess maybe on the left part of the screen, is what I'm calling the CARES Act Mayor and Council Strategic Plan. And then on the other side is what is currently being recommended by the city manager. And so the numbers that I have on the strategic plan for mayor and council are not fixed. They're just kind of a starting point for us to have this discussion.
Walk us through it, council member. I think that you have community investment and support, 24 million, continuity of city operations and services at 36.25, and then reserves at 35 million. So can you walk us a little bit through
some of it? So what we're seeing on the mayor and council strategic plan, it already accounts the funds that mayor and council has made allocations, like the small business assistance, and some of the under the workers and families would be under the mitigation of care for vulnerable populations. So some of it's already showing money that mayor and council has already kind of set aside, but then also kind of giving what are some of the possibilities. The one on the city operations and services is kind of a hybrid of what the city manager had proposed, and then also how we preserve some of those funds for a later date to see what the real need is. So if I scroll down, I can share the document and put it on the chat as well. But as we scroll down, is more of a breakdown of what each one of those areas could potentially look like. So for example, on the small business assistance, we have the continuity grants that we had just approved the last time we met. We have the potential of having an arts and culture grants allocation, and then we have the nonprofit grants that we also approved last week. And then we have the ability to put money aside to do utility and rent and mortgage assistance. We have the mitigation and care for vulnerable populations, where you have the workers and families. We can include more money to support those folks who've been impacted and haven't received unemployment or federal funds. And then also setting aside money for the domestic violence impact by COVID-19. There's also potential for us to put money towards food delivery. We know that a lot of our seniors in schools and food banks have been extra stress on their services during this time, and providing some support there. Thinking about a lot of the distance learning and Wi-Fi access that really came to light during this time, and a need to have that be more accessible for our community, because we know that things are going to look different even starting in the fall. We want to make sure that we're putting, funding aside for community testing so that we can partner with the county to do the broad testing, doing more of the community tracing, and making sure that all our decisions are being coordinated with our Pima County Health Department. And then there's a possibility of putting some funding. I know that we were just having this discussion around childcare and like recreational activities in Kidco, but if we wanted to add, more locations to really ensure proper social distancing and provide that as a service to our community during this time, because we know more folks are going to have to go back to work here in the summer. And then there's just some flexibility of other funds that we might feel like need to be allocated to a certain effort or community need that we have.
Looks great. So you've highlighted some of the areas that we've already taken action on, and then your additional ideas for continuing to invest in the community.
That is correct. And I just wanted to start us off with the framework, but I really want to hear, from my colleagues, my peers on the council of what this can look like. And if there's interest in moving in this direction where we have a strategic plan for how we're using the funds.
I think it's a great starting point. I really like the concept of helping our seniors with food delivery or families with food delivery, Meals on Wheels. I'm thinking Meals on Wheels and vulnerable populations. Also the concept of providing our KidCo program, but a reimagined KidCo, just because there's a lot of people out there that are in the front lines and had to continue working, but yet there's no availability for childcare. We had talked previously about childcare in a previous discussion. I know that the city manager Ortega, had mentioned that the school districts have the possibility of also helping provide childcare from 0 to 5. So we should think about possible partnership with the school districts. And that would include the Wi-Fi access for kids and their learning. So I like what I see. I think that it's a good place to start the discussion. What I'd like to do is I'd like to hand this conversation over to the city manager, just so that we can get his input and his thoughts in terms of what he put in front of us in terms of his recommendations.
Thank you, Mayor, and Councilmember Santa Cruz. Appreciate all the work you put into that. If you could send that to me electronically, I've not seen that, and that way I can look at it and react to it. One of the things that I tried to do based on the last council meeting and the direction that you all provided was identify how we could utilize some of the CARES Act funding to offset some of our costs in the general fund. And although we're going to talk about budget here in a minute, these are all interrelated, as you can now tell. One of the pieces that I tried to do is to look at what our shortfall would be, not only this fiscal year and next fiscal year. And so the proposal that I just saw up on the screen a minute ago, I think can do that, as long as that pot that's held in reserve for fiscal year 2021 is clear that we'll need that in order to balance our budget for the following, for next year. So I'm not sure, Mayor, I can't react to that specifically, but I'd be happy to answer questions as to the approach that I put out there. Again, I'm trying to give you some guidance, if you will, or at least some framework for the conversation. In addition, what I would suggest, and actually Mr. Rankin was the one that guided me on it, we should bring back a resolution at some point in the near future that provides guidance for how these dollars are expended, both in terms of amounts and general pots. So that way, when we get audited from the feds, we're able to have that in our hip pocket. Lastly, I do want to mention that the memo, I tried to include all of the current grants, not just the CARES Act, but all of those that we received, and try to give you a holistic picture of what those dollars look like. And you can see that at one time we were, I believe, initially talking about using CDBG for some of our homeless isolation and quarantine housing. Since then, in talking to Director Morales from the Housing and Community Development Director, we moved that over to CARES Act, freeing up the CDBG for some eviction prevention, et cetera. So happy to answer questions, Mayor, and I can get into a lot more detail that I outlined for you in the memo.
All righty, we have on the queue, we have Councilmember Kozachik, then Councilmember Lee, and then after that, Councilmember Durham.
Okay. Yeah. So Lane, or I guess you're going to send it to Mike. If you could email that out, it's a lot to digest at one time, but it is certainly consistent with the point that I brought up earlier, and that is that we need a process, we need a game plan. We just can't be throwing ideas out at each council meeting, expecting them to kind of find their way into a plan. Last time we met, was going to bring up some ideas, 10 by 10 and 10 by 20 pop-up tents for outside of shelters. Since we own what's purchased with the CARES money, these can be used for parks later on. But there is an immediate need right now for people who are queuing up outside of shelters who are doing the shelter in place, water and electrolyte. Another example, CARES money could be used to kickstart some shovel-ready expansion of shelters. We know that there will be capacity issues that happen within the shelters for social distancing reasons once things do reopen. And so arguably the CARES money could go to help kickstart some expansion of some of the homeless shelters. We also talked about CARES PPE for businesses, for shelter workers and city workers. That I didn't, not having had a chance to digest what you put out, that's probably incorporated in there. Being sure, because you mentioned, Lane, in some of what you said, that the money that we allocated last week for some businesses and families, all that community foundation fund discussion, we have a fiduciary responsibility to assure the money is going to be spent within the COVID-related needs guidelines, because we will be audited, as Mike just said. And if that money isn't closely awarded, then they're going to claw it back, and it'll become a general fund obligation. So the guidelines on how that money is awarded is something that we were going to have a week ago ahead of this meeting. It's still hanging out there. So we need to have that plus the whole equity protocol cinched up before we really start checking boxes and saying this money's going out into the community. You also mentioned, several of us have mentioned preschool. The reality is that we have preschools that are shut down right now, and if mom and dad can't get daycare, they're not going back to work. So beyond our own city-supported preschool programs or daycare programs, those businesses ought to be considered for the CFSA dollars as we get those guidelines for allocation.
I actually agree with that. That's a good idea.
Alrighty, Councilmember Lee and then Councilmember Durham. Thank you, Councilmember Kozachik.
Thank you, Mayor. With this, much like our budget, definitely appreciate flexibility in how we approach this, because the end of the year seems like forever and things change so quickly. It kind of makes me nervous to box us in too much and exactly how much we're going to spend and vote on how much we're going to spend, but also understand the need for some specificity around that. I also, because I follow it so closely in my other day job, there are entire task forces around cybersecurity threats relative to COVID-19. So there possibly are some IT expenses that we have not captured to address very specific COVID-19 vulnerabilities to our IT systems. I don't know, Mr. Ortega, if this is something that we can direct staff to do some sort of a cybersecurity vulnerability assessment to understand the cost that we might want to fit into this picture. But that's something that's important. Is that something that I need to do in terms of a motion to have that done? Or is that something we can just go do so that we can fit this into that picture?
Mayor, Councilmember Lee, I'd be happy to just do that. I think Colin Boyce, our IT director, is already on that. I'll confirm the status and we'll ensure that it's robust enough to address the comment that you just made. So I don't think it's necessary in the motion, and then I can report back to you once it's complete.
Okay.
Yeah, and
perfect. I just want to make sure we capture that.
Yeah, I'm sorry, Councilmember Lee, in that I think that what you want to make sure, because I think there is a telework e-government piece to both Councilmember Santa Cruz and the city manager's recommendation. But so you want to make sure that that number is reflective of that cybersecurity.
Correct, because with the increase of the number of remote workers that we have today, local governments, individuals, there are so many cyber threats going on right now because of that. So I want to make sure that we're addressing that. And also just ask that as Councilmember Kazastric said, that there's advanced time for us to review this prior to voting on something, because there's a lot of money involved here. So that's all I have.
Alrighty. Councilmember Santa Cruz, you put this at the table so that your colleagues and I could still give you input, right? You're not asking for a motion today?
That's correct. I just thought it would be helpful if we had a framework and we, as a council, as mayor and council, we had a plan to give direction to the city manager. So my hope was just to introduce this as a possibility and then work together, all of us here at the table, with all the different needs that we know exist in the community. And just like Councilmember Lee mentioned, making sure that we're not forgetting about the cybersecurity piece in there. So I want to, I just want to help facilitate this as a process for all of us.
Okay, alrighty. I just wanted to make sure that we clarified that you're not submitting this in the form of a motion, but just for initiating a discussion. Also, I just want to make sure that we go back to Steve's comment regarding the workers and families piece, the logistics of the workers and families and how we're going to work with the community foundation to put out those funds is going to be being worked on by the city attorney. And so that's where I think we have to come back on the 27th to have a much more thorough discussion and give the council enough time to take a look at the logistics of that plan. The next council member on the queue is Councilmember Durham.
Why don't you say, based on the feedback from my constituents and the fact that we have already got 400 evictions waiting on hold at the court, I'd like to see the dollars for eviction prevention, rental, and utility assistance increased to $7 million. Do you need a motion from me to put that in place?
Mayor, if that's what you all would like to do, then that would be helpful in guiding us moving forward.
We're not assigning dollars today.
You can make that motion, but you can make that motion, Paul, but dude, sorry, man. I mean, I appreciate the sentiment on it, but
I think that we have to make sure that what I'd like to see happen is just get your opinion, get your feedback, and make sure that we're making sense of the numbers, right? That they're like, we're going to put 10 million here and 10 million there, but we have to make sure that the funds are there. And so what I'd like to hear, I like that Councilmember Durham has said, we need some more money in rent assistance. But I think we have to make sure that we're balancing what we'd like to see invested in versus how much funds we have there. And so I think the input is taken, Councilmember Durham, that you place a high priority on rent assistance. I do also recall in Andrew Greenhill's report that we received an additional $600,000 from the federal government for rent assistance. Is that correct, Mr. Ortega?
Mayor, hang on, let me find that. I know it was in here and I apologize. Andrew, if you have it handy, you're welcome to speak up.
Sure. Yeah, Honorable Mayor, members of the council, the last allocation from the CARES Act that we received word from HUD, Housing and Urban Development, that we received is, about $587,000. It's towards the tenant-based rental assistance program. I'm not sure if the dollars are going to go directly to vouchers, but they are meant to assist the program with administrative fees, other facilities improvements. But yeah, those dollars are allocated to the city, and I defer to Director Morales to talk a little more if she's available about, what expenditures those dollars are eligible for.
Thank you. Thank you, Andrew.
I am available if you'd like me to answer that question now.
Sure, Liz, go ahead.
So, Mayor and Council, I can share that the funds there they equate to 2 months of administrative costs. What has been outlined to us to use for covering the cost of increased rental assistance, because as we have lots of families losing income, the amount of rental assistance we can provide is increased. So that money will help current voucher holders, but it will not necessarily, the funding is not to increase the number of vouchers, but we are, as you know, actively issuing vouchers now. But that cost is to help us with administrative costs and changes in rental costs.
Thank you, Liz. We also have Councilmember Fimbres that is on the queue. Councilmember?
Yes. Hello? I just wanted to I liked the plan that Lane has worked on. I thank her and her staff for putting it together. And I had a couple of questions about the homeless isolation and quarantine housing. We already committed $4 million. Is this in addition to the $4 million already committed?
Madam Mayor, Councilmember Fimbres, no, sir, that is the entirety of the $4 million that's been committed so far.
And then I see eviction, prevention, and rental assistance, $3 million. Is that an addition, or is that already committed? Mike, do you know, or Lane?
Mayor, Councilmember Fimbres, that is the total for that particular area. But I believe if you look under CDBG, I'll look to make sure, we've also got some in that pot as well, eviction prevention, et cetera. So that's the CARES Act monies that are allocated. And then on top of that, we have some CDBG Community Development Block Grant monies. Liz, feel free to add if you'd like to.
Yes. So we do have those funds that we do plan to use at minimum $1 million, but we have up to $3 million in CDBG and an additional $1.6 million in ESG. So we are planning to use a significant amount of both funds for eviction prevention.
Okay, good. The other question I have for you, Liz, is that in the summertime, we add a bunch of heat respite sites, areas to help us with people that can go get cooled off, drink water, and cut down. Are we planning? We have some of this looked into this. Do we have any of those?
Mayor, Councilmember Fimbres, definitely we are looking to do it for cooling stations, hydration to help those who are out in the heat.
Okay. And then the other thing, Mike, I know we had discussions in the past about public bathroom sites in the area so that we have more access to those for people, especially when we had all the tourists coming in and checking out, doing the turquoise walk and stuff in the summertime. So that was one of the issues that we brought up. And then when Army Park has their events, there's not enough public bathrooms in that area also. And then helps some of our transit population.
Mayor, Councilmember Fimbres, that is a thought. I will tell you that our numbers our funding is going to be going fairly quick. But retrofitting some of those public facilities is definitely on our radar screen, and we'll keep going down that path, particularly in the new designs for the restrooms.
Good, because that's where I was headed. Thank you.
You're welcome.
Thank you, Madam Mayor.
Thank you, Councilmember Fimbres. So the last person, I don't see anyone else on the queue, is Vice Mayor Cunningham.
Really quick, we've really got to assess need before we start assigning dollars. And this is a really good example. Right now, we're pending probably about 900 evictions, give or take. And then you can say, all right, there's another maybe 500 or 600 waiting in the wings. Well, even if we have 2,600 pending evictions, to pay off all those evictions along with fees and whatever, the most that's going to cost is $3 or $4 million. And so to put 7 in, I think some of those might be able to get settled. Some of those evictions might be legitimate. I want to be we got to watch our money, because I want to be sure that we're in a position to kind of, if this pandemic ends, one of these vaccines works out, or they find some treatment protocols that work out, I kind of want to hit the ground running on some of the stuff we were working on. And I want our budget to be solid so that we can go back to some of the capital improvements that were due to this city for a long time, making sure some of our commerce is whole, so we don't have, we're going to have a lot of people kind of under the gun in debt who kind of made it work over the last 6 months. And we need to think about that whole process on the universal. We're going to have about 75,000 to 80,000 households behind the 8 ball. We're going to have some money to help them out, but we've got to have a process on how we're going to divvy it up and how we're going to kind of identify those needs. So I want to kind of identify those needs before we start assigning dollar amounts.
Thank you, Vice Mayor, and that's a perfect transition. And thank you, Vice Mayor, Councilmember Santa Cruz, for putting your thoughts on paper and really spending some time to kind of give us your view of what we should be doing with the CARES Act funds. I like the idea of being able to define it much more, and with an eye, like you said, to equity, which I believe answers the question from Councilmember Kozacek about the equity framework that we had voted on before. So this particular plan really takes into account that equity framework of investing in the community, and then of course investing in continuity of city services, and then of course reserving some funds to make sure we're taking care of our future needs, especially our budget, which is what Vice Mayor Cunningham is saying right now. As we think about it, and I'm pretty sure that my colleagues on the council can reach out to Councilmember Santa Cruz, I believe, to just give some input after you review her plan, to see if you want to give some input and help put this plan together. I'm thinking that maybe we bring it back on the 27th. So we can continue discussing with your input already on it. As you said, Vice Mayor, I think we need to think about, yes, the immediate needs, our CARE Act funds, but we also, I've been thinking for many weeks now, how important it is to act and act quickly for the urgency that we have in front of us, but also plan ahead. And I'm talking about how all this money matters when we want to build a more resilient, economically diverse city. And so I have been participating, like I said, I participated in last week's Pima County's Back to Business Steering Committee, because I have a commitment to work in partnership with anyone in this city and this county to move our economy forward and our workers forward. And so I participated in that Back to Business steering committee. I also met for the first time with my Economic Development Advisory Council. It's an ad hoc group that I chose different and diverse people in the community to talk about how we start thinking about policy to get us out of this pandemic recession. And so with that, we have to make sure that the funds that we're using right now make sense to push us into a better, more resilient city. And that includes our workers, our families, our small businesses, our nonprofits, our arts and culture, our children, and our schools. And so I'm glad to hear your input. And I think the next steps is that we have a special meeting on May 27th, which is next Wednesday, to review the additional discussion for this particular item. And then, of course, to review and approve, hopefully, the logistics on the We Are One Somos Uno Resiliency Fund and those funds that are going to nonprofits, small businesses, and workers and their families. Mr. City Manager, do you have anything else to contribute to this particular item?
Mayor, members of the council, I think we covered the expansion of premises in the conversation when I believe Councilman Kozaczek was speaking. I did want to let you know, staff and I have been working on a concept. Have not totally fleshed it out yet or fleshed it out. The idea is to kick off, we'll call it the reopening of the city, again, gently, and all things go along with that, with a community-wide cleanup. One of the thoughts there is to mobilize the city staff, obviously through volunteers, during work week, where we identify the community and go out and take care of weeds, et cetera. But I would also reach out to you as the council and obviously you, Mayor, your contacts at some of the leadership in the neighborhoods to assist corporate folks as well. So we're going to put those together and come back to you with an outline of plan, but we're moving forward. We think it's a good opportunity for us to bring the community together, really enhance some of the conversations we're having about keeping the community moving, but also doing it in a safe way. So Mayor, I'll come back to you and give you a little more on that, but at this point, we're looking at sometime the week of the 8th to kick it off, and it would only be a week long, but it does give us an opportunity to let people know that we're excited to be out and about.
Thank you, Mr. Manager. Well, with that, then we're done. Finally, it took us, 2 hours to move through items.
I got one thing, and that is just to respond to the comment that we should all be reaching out to Lane with our input. That's probably an open meetings thing, and so we should maybe filter them through Roger or, I don't know, Rankin. How would you like us to do that?
Mayor, Councilmember Kozaczek, Steve, thanks for jumping in there. Yes, I was getting the manager's attention to unmute. So for the discussion on May 27, what we're hearing is that we will certainly specifically put on the agenda the discussion of proposal for the expenditure of the CARES money, so you can give further input at that time. In the meantime, if you have reaction or input to give in response to what Councilmember Santa Cruz has put together for your information, please get that to the city manager and he'll assemble the information so it can be put together for the agenda materials in advance.
Okay, then we need the spreadsheet emailed to us all.
It's in the chat. You can grab it in the chat, Councilmember Kozaczek, if you'd like it right now. I think it's available through the chat.
We need to make sure we send that out as well.
I think I lost my place, but alrighty. So we're on to item 8, which is, oh, we did that already, right, council members? We pretty much talked about the reopening for business, which is item 8. We are moving on to item 9. This time has been set aside for the ongoing discussion of the fiscal year 2021 recommended budget. Mr. City Manager.
Yes, Mayor, thank you. So I gave you a spreadsheet. I gave you a memo that outlined some thoughts. You'd asked me to come back to you with some recommendations. I have done that. In summary, what I've done is identified $40 million of CRF or CARES money and an additional 39, almost 40 million, just short of 40 million that we would use from the FTA money. What that does, and Mayor, if you bear with me, I'll try to put that up on the screen here. I do want to point out, so as you see the map here, or the spreadsheet, the bottom line is that if we go down the current path this fiscal year of 1920, we'll end with an apparent surplus. That's by design so that we burn down these costs. And by the way, I was just informed during this meeting, we did get our second installation from FTA. So we're now up to about 16 million of that reimbursement. So that was good news. Then if you go into the 21 year, just to refresh your memory, we had identified about a $41 million shortfall. I increased that by 5 million because I'm expecting additional costs in our transit system, which then is taken out of the FTA money down below. So when you finish the year, we finished the year in 21, we have an apparent surplus of about 9.2 million based on adding those two FTA and CRF monies. But then our focus needs to go to the 22 year. And although we talk about them in single year increments, I think it's important that you see the long-term implication of decisions that we make today. Doing nothing, if you will, are expected increases in both revenues and increases in costs will leave us with about a $44 million shortfall in 22. If we take away that 9 million that we have in cash carry forward from the prior year, that gives us about a 34 million, almost $35 million shortfall in 22. That might seem like a long way off, but unfortunately it isn't. And B, decisions that we make now about ongoing expenditures will affect that bottom line. I still recommend that on a monthly basis, I will come back to you and have conversation around what actual revenues were for the month prior, as well as expenditures for that month that's upcoming. I also included down below or towards the bottom here, the amount of prior commitments. Those dollars add up to about just shy of $17 million. I wanted to make sure that you didn't lose sight of those. Those are things that we've discussed in the past. Obviously, if this number, this $34 million number holds, I will not recommend that we increase that number by another 17 or $16 million. But I did, again, want to make sure we keep those on the books so that you can see what impact those might have going forward. So with that, Mayor, happy to answer any questions. Again, the memo, I think, was self-explanatory and happy to, and Joyce is also online if you have questions for
her. Who's on the queue? No questions
Mike,
so far?
can you post that spreadsheet in the chat?
Are we on item 10?
We're on the budget.
We're on item 9, Councilmember Durham.
Oh, okay.
Steve has a question. Councilmember Kozachek, I believe, has a question.
Yeah, I thought, Paul, are you done? Thought Cunningham was looking at the.
Yeah, I'm done.
No, I mean Cunningham.
Oh, okay.
Well, I'll go. That's all right, fine. So,
Yeah, go ahead,
Okay.
Steve, and then we'll come back.
okay. So,
Mike, I was
have-
saying, put it on the chat. Just post the actual document to chat, like Lane did.
Oh, I'm sorry. Okay, I can do that.
Alrighty, so,
I'll leave it up in case anybody has questions.
Alrighty, Councilmember Kozachek.
Yeah, so thanks. The reality check, we're plugging the spending and revenue gaps with one-time money. And whether it's, which is fine, just as long as we keep it in mind, that whether it's coronavirus money or our reserve fund, hoping that the costs and revenues are just going to fix themselves really flies in the face of all the economic projections being made by, serious economists all over the country. The recovery's going to lag. We know that, and if we get a resurgence, it's a whole new conversation, as I think Mike pointed out. We're not going to get the structural balance by relying on one-time dollar, whatever pot of fund that is, and ignoring the revenue expenditure realities that are in front of us is kind of like just sticking our finger in the leak in the dam and ignoring the structural pressures that are causing it. And by way of examples, families got their $1,200, but they're still out of work and they still have bills to pay, and that one-time money didn't change their income reality. So, Mike, I appreciate the measured approach that you're taking. We can't assume that the revenues and expenditures are going to fix themselves, and so being flexible and recognizing that we are going to have at some point to make some reductions in how we're spending these dollars, city dollars, as revenues lag, is really going to be something we got to keep our eye on the ball for.
Thank you, Councilmember Kozachek. I think that the 5-year forecast, does it forecast any growth after 21-22, Mr. Ortega?
Mayor, it does. So if you look at, here, I'll actually highlight it for you. If you look at the revenue piece here, recurrent revenue, you can see that it goes up each year. So you can see that it goes all the way up to 579. It's between a 2 and 3% growth. And again, our crystal ball is as good as anybody else's at this point. That is how we have done that. But I show you that in comparison to the increases in expenses here, which we're expecting to be health insurance, pension costs, et cetera. We know to some level what our pension costs will be going forward. And so if you notice, this number, this shortfall on an annual basis is about the same. And that's because this one right there, that shortfall is about the same for the next 5 years. And the reason for that is because the revenues are going up at about the same amount as the expenditures. So we're not making up any ground, if you will. Now, if there's a strong recovery, then we would see those drop, those shortfalls drop. But at this point, it's almost parallel, basically. So we've seen such a big drop, and then the increase in expenses equate to the delta, if you will, of the increase in revenues.
Mm-hmm. Thank you. Really appreciate it. Any other questions? Anybody else?
Yes, Your Honor.
Okay, Vice Mayor?
So just for everybody looking, we're projecting, we're not gonna have to draw from fund balance for for 21 and 22. And will that go into our existing fund balance, Mike?
Mayor, Councilmember Cunningham, the fund balance will not drop through 21. In 22, if we do nothing, then we have to start thinking about fund balance utilization for the 21-22 year.
And
so that
we're going to add that 20 million into fund balance this year, correct?
That's correct. Any excess dollars that we have based on reimbursements that we received would go directly into fund balance. for use in the following and subsequent years.
So we'll have about, what, 80 million in fund balance in 22 if this all holds?
So if this holds, if you look at the 35 million plus the 66 million, will be a little better than 100 million in fund balance that's available for the subsequent fiscal year. Keeping in mind that the 66 million is pretty much the entirety of what we have available that we've talked about.
Right. No, I understand. I'm just trying to wrap my head around. See, and also remember, I'm a little more rosy for 22, where I think that's where, like, I agree with the 2 and 3% conservative approach, except there's going to be a little bit of reverb if we get a vaccine or if we get, you know what I mean? We're going to get a reverb, so that you're not going to be able to say, hey, there's going to be 20% growth and we're going to get it all back, but you can say, hey, we're going to get, 7 or 8 kind of. It's kind of like 2, 3, 3, 7, 3, 3, 3, like that. I think that's probably a better forecast. It doesn't matter. I'm just trying to. What we have in front of us is at least encouraging, and at the end of this fiscal year, and probably in FY21, we're going to be able to meet our needs, and we're that 20 million for 21 will help. I just hope that we can, we don't. That means we're predicting a 20%. Looks like we're predicting about a what is that? 5-6% down in 21 from 20, from our original projections of 20, not what we actually took in 20. So that makes sense to me.
Yeah. So,
all right, I'm actually good. Are we going to have some recommendations to close this gap for 21? Like, do you need a timetable for that, or do you just want to kind of put this out there today?
Mayor, Vice Mayor Cunningham. So my strategy is this. We are starting now to look at that 22 year, because remember, the 22 years sounds like in 2022, but it actually starts July 1 of 21. So the plan is to identify strategies to I'll call it gently walk down the slope to July 1 of 21. And so the thought is to address that on a monthly basis, looking at how we reduce expenditures in a real-time manner, so that we're not doing it wholesale. We're doing it in a real-time manner based on the recovery, based on what our revenues are. Remembering that we had projected a 15% drop on average between July 1 and December 31. So that's an average number. Moving that up about 2% a month beyond that, starting in January. So I'll be able to give you real-time information on a monthly basis on adjustments and tweaks that we need to make going forward. So that's really where I'm going to come back to you on a regular basis and say, okay, here's what this looks like, and here's some real-time information on expenditure reductions, or our revenues are going better, or maybe the revenues go worse.
All righty. Any others?
Yeah.
Steve.
Yeah.
Steve.
So Paul Cunningham, I don't claim to have any more accurate crystal ball than you do, but I'm looking at Ducey's reopening. I think the likelihood is greater that we see a resurgence before we see a vaccine, and so I appreciate the conservative approach on the finances, because this could even turn more negative before it turns more positive if in October of this year or thereabout or sooner we see another spike up in this whole COVID thing. That's my big concern. I see people going to bars right now and hanging out, and like this didn't even exist, and that's really concerning to me. But maybe we'll get lucky.
Mayor?
Yeah, well.
Mayor?
Yes, Mr. Manager.
I just wanted to, I'm sorry, I apologize. I should have asked Joyce if she had anything to add. Joyce, did you want to add anything? She's our CFO and should probably be weighing in as well.
Well, thank you, Mr. Manager, but I don't have anything really more to add to this conversation. I do think that a junction approach is possible going into fiscal year 22. And as far as revenue growth, we may see a larger revenue growth, but I'm not convinced yet that that's going to occur. And I don't think that anybody else yet is. We just won't know until we start going through the next fiscal year, not the current one, but the next fiscal year. That's all, sir.
So we're taking a careful and conservative approach to the possibility of economic growth in starting year fiscal year 22.
Yes, ma'am.
Okay. All righty then. I think that we do have another opportunity to continue discussing budget for the 27th. I think that would be appropriate just to finalize our thoughts on the budget and then approve what we need to approve for the city manager to move forward. So without any additional questions, I'd like to move us to item 10. Time has been set aside for discussion of the alternative expenditure limitation options. Mr. City Manager.
Mayor, members of the council, this is I'll call it a somewhat routine conversation because we've had it before, but unfortunately we don't have it very often. So I'll turn it over to Joyce. She can educate you on the detail here. Joyce.
Thank you, Madam Mayor and Mr. Ortega. I did want to take the opportunity to discuss with Mayor and Council what the expenditure limitation is. The last time we discussed a limitation was actually in 2013. And my intent for this item started with when we were going into the 21 budget year, I actually thought we would be running up to our limitation. And I'll actually define the limitation in the near future. But I thought we were going to hit up against that cap. And once you start going up against that cap, then we have to start thinking about alternatives to that limitation. And what that normally means is going out to the voters. But since the COVID-19 and with our revenue drop, we do have some flexibility now in our budget capacity for the upcoming years. So therefore, I think that this is really just an educational piece, particularly since we do have new council members, and they may have seen some of these limitation figures on the recommended budget documents that we gave to you back in early May. But I'd like to really define what those dollars mean, what the limitation is. So, and I do think there is a PowerPoint presentation. Roger, are we able to get that up?
This is Suzanne for Roger. We're working on that right now.
Okay, thank you, Suzanne. Well, I'll start talking about it. So for those of you that may not be as old as I am, what happened was in the late 1970s, the costs for government were increasing tremendously, and it was putting a lot of burden on taxpayers, particularly when it came to California and their property taxes. So there was a proposition, and it was Proposition 13 in California that passed in 1978. And what that proposition did, the voters approved a cap on their property taxes. So when that passed in California, it wasn't long till other states, other voters started putting in certain limitations on the growth of government. So what happened in Arizona, this was actually in 1980, the voters actually approved on the Arizona Constitution this limitation. And this is the purpose is to control the expenditures of government, basically. Every year, this cap is adjusted for inflation and population growth. And then the Auditor General is the one that provides us the information on what our cap is going to be. So we have very detailed reports on how to complete the process for this limitation. I did include with the presentation materials our audited expenditure limitation that is done annually. So on the next slide, we actually show you how they calculated the expenditure limitation calculation. And what that is they took the 2019 population of about 546,000. Did a price deflator. It's actually an inflation factor. So you multiply your population times the inflation, and that's where we get our expenditure limitation, which is $1 billion. It may seem like $1 billion is quite a bit of capacity, but it's actually, we're going to get up there very, very quickly. So I just wanted to kind of show you the calculation and then talk about a little bit about the population, because what occurred in the last population census, the city of Tucson actually lost population. And when you lose population, we actually lost some capacity to spend. So I'll talk a little bit about that later in the presentation, but I wanted to tell you how important some of those pieces are, particularly the population factor. So on the next slide, the budget is actually made of the spending of local revenues and the spending of revenues that are excluded from the limitation. So our local revenues actually make up the piece of what the subject to the limitation is. So on the next slide, we just kind of show you, give you an idea of what do we mean by local revenues. Well, local revenues include all of our taxes, including the primary property tax. It includes all of our state shared revenues, any charges for services, including our utilities, our water utility, environmental services fees, licenses and permits, other fines and forfeitures, and then one item we may not think would be subject to local revenue, but that is development and impact fees. So on the next slide, we talk about, well, what's excluded from this cap, this limitation? And they do allow for when we have bonds or certificates of participation or other long-term obligations, such as those financing, any of those expenses or expenditures against bonds and certificates are excluded from the limitation. We also have our trust and fiduciary revenues. So for us, that's the TSRS pension fund. Federal and state grants are excluded. Any debt service payments on our long-term obligations are excluded from the limitation. Any reimbursements from agencies for services, so that would be like RTA and PAG. And then the other thing that we have to factor into play here are internal charges between our city funds. So for example, our water utility and our sanitation fees are charged to other departments. So we have to make sure we eliminate those so that we're not charging ourselves for something that's done internally. Now, the question may be, okay, we go through all of this, we start getting together the audit paperwork that actually are going to go to the Auditor General. Well, what happens when you exceed it? So on the next slide, the state can actually withhold our state income tax. And as I've listed here, it depends on how much you go over your cap as to how much will be withheld. So it can be anywhere from less than 5% to 10% or more, almost up to a third of the total allocation of income tax. Now, when this does happen, and I will tell you that in my tenure with the city, we did go over the limitation one time. We did get a special dispensation for that, and where we went over the limitation, the city actually had its own deferred compensation plan, and we managed that ourselves. And when we went to an outside provider and we wrote that check giving all the deferred compensation items to that third party provider, that actually went against our expenditure limitation. So we did get special dispensation for that, and we haven't done it since. We've always stayed under it. And so we just need to realize that if we do go over it, there are penalties that can be incurred. So on the next slide, what I want to really talk a little bit about are what are those expenditure limitations that can be overridden? How do we get more capacity to spend? How do we adjust for that? So if there are a natural or man-made disaster, either declared by the governor or the mayor, then those expenditures are excluded from our limitation. Now we can also go out to the voters and we can say to the voters, we would like to set our budget. We would like to be able to spend X dollars, and they can say, all right, you can go ahead and do that, and you can set your own limitation as a city, but it's only good for 4 years. So then every 4 years, you would have to go out to the voters again and say, the city wants to set its own budget, and we'd like to get that as our cap for the limitation. The other methodology is to go for a permanent base adjustment, and this is what we did the last time we went to the voters. We actually go to the voters and we say, we'd like to increase our cap by a certain amount. The last time we went to the voters, we went for $50 million. And so we said, okay, we'd like to increase our cap by $50 million. The voters approve it. And once they approve a permanent base adjustment, it's just that. It's a permanent adjustment. So that continues with you through the course of time. And then there's another way that we can do this, and that's to have a one-time voter override. And this just says, let's just say we were at the cap and we had our reserves. If we were at our cap, we couldn't take our reserves and we couldn't spend them. We would have to go to the voters and say, voters, we want to take all our reserves and we want to be able to spend them in the next year. And we would have to get approval from the voters. So on the next slide is actually just our limitation history. So in 1981, they actually, the voters passed $800,000 as a permanent base. Again, in 1987, we had 46.9, almost $47 million permanent base adjustment. We came up to our cap again in 2004. And so in 2005, we got a home rule option, and then that sunset. So the last time we went to the voters was in November of 2013, which was for a $50 million adjustment. Now, when I say $50 million adjustment, that's to the base. So you would actually include with that the population factor and the inflation factor. So it's actually can be almost 4 times that amount. And when we did the analysis in 2013, we thought it would hold us for at least 8 to 10 years. So just some future considerations on the next slide. As I mentioned before, the census does play a huge factor in our base, how much we can spend in our local revenues. So we lost $22 million of spending capacity at the last census. So this is another reason why our census is so critical to the organization. Now, continued revenue growth, and that means just with our sales tax, with our utility charges, all of that plays into those revenues that are subject to the limitation. We had a few propositions which didn't count on in 2013, which was the zoo proposition and then our Tucson Delivers Safer City and Better Roads. We didn't count on that, and when we did go out for a sales tax increase, that is all subject to the limitation. We also have some other things that we're doing, which is different than what we thought about in 2013, and that was more as a pay-as-you-go for our capital program, particularly with our water utility. When you do use those local revenues instead of, let's say, bond proceeds, those expenses are counted toward the limitation cap. So I'm open for any kind of questions you have right now.
Anyone on the queues? Anyone wants to jump in with questions?
Yeah, I would like to.
Councilmember Jerome.
What's the timeline for the mayor and council needing to make a decision on this? Did I see in the memo that it's a couple of years?
It appears now we have a couple years before we need to make a decision whether or not to go to the voters, particularly with the loss in revenue from our sales taxes.
And Joyce or Mike, do you have a recommendation in regards to whether we go with a home rule or a permanent base adjustment to increase the expenditure limits?
So for me, my recommendation would be a permanent adjustment because you actually can buy a longer period of time. With the home rule, you only have 4 years and then you have to go to the voters again. But if you can pass and we did a few times, a permanent base, that will last you a lot longer than the home rule.
I would agree, Mayor and Councilmember Durham, I would agree with that as well.
Should we look to the exemption of expenditures related to an emergency like COVID-19 pandemic?
That's a great question, sir. So we are assuming that all of our costs, if they are part of the CARES Act relief fund and reimbursed from FEMA, will not be as counted towards our expenditure limitation.
Alrighty. I don't see anyone else getting on the queue for questions. Thank you so much for the update, Joyce. I believe whomever shared the screen put us on a weird bag lock screen. So
just touch your little screen.
Okay, that's great.
Touch your little screen and it'll take you back to your regular screen.
Okay, I couldn't, but then I believe we can move on to the next item, which is item 11. After item 11, I'd like to give us all a break, about a 10-minute break. So let's start with item 11. Time has been set aside for interested parties to dispute the fiscal year 2021 compensation plan. Mr. City Manager.
Mayor, just a second. Hey, Joyce, I think you're still sharing your screen there.
That's better. That's better. I think we're back to normal.
Okay, I'm sorry, Mayor. I was distracted there. What was that? Excuse me. This is on.
We're starting item 11, Mr. Manager, and this after item 11 is done, we're going to take about a 10-minute break so we can stretch our legs and take a little break. But let's start with item 11, which is the compensation plan recommendation.
Yes, ma'am, Mayor, I apologize. So this is a matter that is outlined in the charter. Council has to consider. We go through a process. There is a hearing that you held. We did have some comments from employees. I believe, Mayor, you sent me a note you shared with the City Council on what that hearing entailed. That has been shared with Council. You did ask for confirmation. So I'll turn it over to Ana Oquijo at this point to give you a little more data on that. So Ana.
Thank you.
Thank you. Good afternoon, Mayor, members of the Council. Yes, as Mr. Ortega has stated, today is one of the final stages that we are required by City Charter to address Mayor and Council with in terms of employee compensation. The first one came as a May 5th recommendation on the annual compensation plan, which included to stay as is in light of the changing economy and the unknowns coming forth. And the second portion of that was a public hearing that Mayor Romero held last week as well, just after the May 5th council meeting. We had one dispute filed by one of our labor organizations, and the primary, the premise or foundation to the dispute focused on some of the recommendation included reference to halting or suspending rather market reviews in light of COVID-19 economic factors that were unknown. So I wanted to clarify as part of that, because current reviews that are already completed were pre-COVID-19 or based on pre-COVID-19 economic conditions, and any continued compensation reviews may have to take into account any impacts or shift in market posture as a result of a changing economy. I think that's really the premise of why we said suspend what we're currently under. But the Human Resources Director is required by city charter to, or responsible for ongoing review and analysis for the purpose of determining competitive market postures. So as such, market studies will not be halted from that perspective or suspended, and Mayor and Council will have the ability to discuss with the opportunity to formally consider adjustments to the compensation plan along the way on an ongoing basis. We do consider, obviously, the economic conditions as those permit, and based on any changing competitive posture for the City of Tucson as an organization. So I did want to clarify that, and we will send written clarification to that point to our employee representative organizations to, so that they also know that we continue to work with them monthly through Labor Council and with employees in general. So that was it, and if there are any questions, I'd be happy to answer.
Thank you, Anna. I really appreciate all your work on this, and I want to thank, as the mayor, and I know my colleagues on the council feel the same, thank the hard work of all of our employees, from our communication workers to our environmental services and sanitation workers, police, fire, parks workers, Tucson Water, housing. I mean, all of our employees, including the city manager, his team, and every single one of our department directors have done so much work and really stepped up. I've said this before, have really stepped up in this time of crisis to really work on this together. And so before COVID-19, as we all know, our economy was booming. We really worked diligently for many, many years to keep a rainy day fund healthy. We started to give our employees cost of living adjustments and salary increases. We were in the process of moving all of our entry-level workers in the city of Tucson, moving them from minimum wage to a minimum wage of $15 per hour. We took that step. We were humming, we were moving along, in a really good place. And unfortunately, this pandemic has hit us and has hit the world. And it's very unfortunate that at this time we have to say no to our plans, right? All of our plans that we had. But being at the public hearing, I believe it was May 8th, Anna.
May 8th was the public hearing after the May 8th council meeting, correct?
Being at the public hearing and listening to the input of the different labor organizations in our city, one particular dispute filed by Tucson Police Officers Association basically said, let's not lock ourselves to future discussions about compensation and market studies. And so what I requested at that public hearing, and then I followed up with a memo, I just want to make sure that in the written statement that we have in front of us at Mayor and Council, that we specifically verify that market studies will not be halted until 2022 at this time. Because I believe that Mayor and Council will have the ability to discuss with the opportunity to formally consider any adjustments to compensation rates on an ongoing basis as our economic conditions persist. But I believe that our labor group said, let's not just say in a written statement that we need to halt it till 2022. we'd like to leave the door open a little bit more. And I tend to agree. I think we need to leave the door open as to how we move and how we talk with our labor groups about compensation and market studies and all of that. So, Anna, I just want to ask how we will change that language to reflect consideration for labor groups on this item.
We had, thank you, Mayor Romero. We had planned to just follow up with a written memorandum to exactly that point and follow up on those conversations. And that was my clarification for that purpose, is that we won't halt our reviews because we constantly have to scan our market, and just because of the unknown of what the market posture would bring, we're just not certain what reviews we will use. But as we go through that, we will not stop the communication, and we will continue to keep all of our representatives as part of that conversation. If that suffices with a written memo, I can pursue that after discussion today.
That would be wonderful, Anna. That would really solidify the sentiment. And just for my curiosity, are market studies done annually? How are they done? Are they done for each department? Are they done citywide? Are they done for particular professions? How do you do market studies?
It's a combination of things, Mayor. We, again, our foundation is city charter. We have an obligation to scan the market posture once a year, and that's what we follow by these two exercises we recently did. But throughout the year, we identify benchmark classifications. We look at a combination of things, perhaps of areas that we're having difficulty in retaining employees, high turnover areas. We communicate with department directors to see what areas are not only difficult to hire, but where, we feel we just are under market, and, just kind of get a gauge ourselves before we go out. So this past year, we had 152 benchmark positions. We worked very hard, and I echo your sentiment on the continuous work that we've done for the past few years on reaching our goals as part of the city manager's employee retention plan, and we've done really well in that regard. So we also look at different cities of comparable size. It's very difficult in the state of Arizona because Tucson doesn't have very many comparable size in terms of population, but we have a few similar that we're able to include in our comparisons. We tend to go more with the type of position and see what cities have similarities so that we can benchmark across the same type of functions. So we did lots of work. That's the intent. That's the purpose of the annual position for the market posture. I know in past years, before we established the goals through the city manager's office, there was no funding availability. So we were very limited in the past on what market posture or market analysis was even done because we had so much other catch up to do, if you will. And we would participate in different compensation studies with other cities. We also would take very, very high retention areas into consideration and do very limited work. This past year, we opened it up more broadly and in an effort to try and come back to some type of a classification maintenance review in the future that would phase out for future years a funding plan to try and get to a closer position toward those goals under the employee retention plan. So I hope that's a quick summary, but that is the basis for our market reviews.
Alrighty, thank you so much. I know that you had been doing a lot of work And based on that, Mayor and Council also had requested that that our lowest paid employee move from whatever minimum wage up to $15 an hour. And I just wonder if that conversation is going to continue based on our economic forecast that we have in the city of Tucson. That might not be your question, Anna. It might be the city manager that could answer for me.
Sure, Mayor. Thank you, Mayor. As you recall from the budget discussion on the prior commitments, there was actually a line item for employee pay issues that we've discussed in the past. So it is on the radar screen. It is not recommended for 21. I expect that about a year from now, the council will address that as well as other recommendations. And again, it'll be fluid based on what's happening with the economic recovery, et cetera.
All righty. Well, thank you so much. Yes, if you address that, Anna, through a written memo to Mayor and Council, I think that everyone would just feel good about it.
Very good. And just one final comment, Mayor. What happens from this point forward is I will come back during the month of June, probably at the latter meeting of June, with the actual adoption of the compensation plan. And that's the final step in this process for the year.
Thank you, Anna.
Thank you very much
for your hard work. And
You're
thank
welcome.
your team.
Thank
Really
you.
appreciate it. All righty. So that is item 11. I'm going to take a point of personal privilege and ask for a little bit of a 10-minute break. I believe, Mr. Clerk, we can stay on, but put your mics on mute and your cameras off, and then we can take a break and come back to item 12 and finish the study session item. Mr. Clerk?
Yes, Your Honor.
All right, that's how
Aren't we going to do
would like.
executive session?
I'm sorry?
Your Honor, aren't we going to do our executive sessions?
We are, but we're just taking a break, Vice Mayor. Just a little bit of break, just to use the restroom and kind of stretch our legs. Please stay on. Just put your camera, turn your camera off and put your microphones on mute. And we will be back in 10 minutes. Okay? Thank you all. Manager Ortega and Liz Morales, our Department Director for Housing Community Development. Let's start. Time has been set aside for discussion of phase 1 of the housing market study. Mr. City Manager.
Thank you, Mayor. This item is brought before you as an update, and will also help inform conversations going forward about the approach. This is in response to previous directions been provided by the council. With that, I will turn it over to our Housing Community Development Director, Liz Morales. I know that she has some members that helped her, I believe, from the U of A, that helped her generate the information, and they'll all be available to answer questions as well. With that, Director Morales.
Thank you, Mr. Manager. Good afternoon, Honorable Mayor and Council members. Thank you for this opportunity to publicly share the housing market study. Most will remember a discussion on the evaluation of the infill incentive district in 2018-2019. At that time, stakeholders had expressed a need for better understanding of factors impacting the housing market in the downtown area. At the same time, there was a growing concern regarding housing affordability and availability citywide. To better understand the city's housing challenges and needs, the mayor and council at that time directed staff to conduct a housing market study. As a result, I'm happy to present the first phase of the study, which is the creation of the Tucson Pima County Neighborhood Vulnerability Index, which we will refer to as the NVI. The city and the county partnered with the University of Arizona, Eller College of Management's Economic and Business Research Center. We are fortunate to have Dr. Alicia Kim and Dr. George Hammond from the University of Arizona to walk us through the NVI. We will hear about the methodology and the 5 indicators that make up the vulnerability index. After the presentation, we can discuss and address any questions. Dr. Kim?
Hi, I'm Dr. Alicia Kim. Thank you for having us. I'm going to share my screen with you and then walk you through the Neighborhood Vulnerability Index. So we've housed the index on the Making Action Possible dashboard, which hopefully everyone is already familiar with. So we have several pages here. This is the main page, and then there'll be 3 more pages that we'll walk through. So we made a partnership with the City of Tucson and Pima County to create this index. The first phase of the study was to identify vulnerable or stressed neighborhoods within the region. Vulnerability in this context refers to the ability of members of a community to withstand threats to livelihood, security, and social, economic, or political networks. So we modeled this entire index after the Austin Uprooted Vulnerability Index. So we used the same factors that they used, which were these 5 factors that signal vulnerability in a community when assessed together. So that includes the percent of residents that identify as anything other than non-Hispanic white alone, the percent of households who rent, the percent of residents aged 25 or over who lack a 4-year bachelor's degree or higher, the percent of households with incomes below 80% of the area median income defined by HUD, and the share of children that live in households below the official poverty line. So in this, we created an index using those 5 factors, and then we mapped those on an interactive map, which you can see here. I'm going to click on the full screen map just to make it a little bit easier to see. Any user that comes to the site can do the same. So we have the entirety of Pima County here. You can move around this map as you like. The default shows the city of Tucson boundary. You can turn that on and off as you like. You can also turn off the tract boundaries. So each of these red outlined areas is a census tract. When you are counting the census tracts in the entire county, you have 241, and there are 157 of those are city tracts, which means they were either the tract is wholly or partially in city limits. We have, let me see if I can, I can move that. So if you look at our legend here, you can see that the colors tell you the level of vulnerability of each tract. So the lightest color, or virtually white, being not vulnerable at all, and then this blue color being vulnerable, this medium color being more vulnerable, and most vulnerable being the dark purple. In any tract, whether it's vulnerable or not, you can click on it, see the census tract number, the composite score, which we'll discuss in just a minute, and then each of the 5 vulnerability factors. There's a no or a yes next to each of those 5 factors, and what that means is that the tract is vulnerable specifically in that factor, either yes or no. We also have other cities and town boundaries, ward boundaries, and the County Board of Supervisors boundaries. So what we found in the 2018 study using the 5-year ACS 2018 data from the United States Census, it's collected and distributed by the census, we found that of the 241 tracts in Pima County as a whole, there are 103 vulnerable census tracts. Of the 157 tracts that are wholly or partially in city limits, 87 of those are vulnerable in some way, which means 55.4% of census tracts in Tucson. So if we go to the next tab, we actually measured how Tucson changed between the last adjacent 5-year ACS, which was in 2013, to the most current one, which is 2018. So this is the same map, the same functionality, except what it shows here are only those tracts that changed at all in vulnerability status. So 16 tracts in the entire county went from not vulnerable to vulnerable, while 13 went from vulnerable to not vulnerable. You can see the details of these tracks here. You can click on it. It tells you here if it changed to vulnerable in 2018, or if you click on one of these, it tells you it changed to not vulnerable in 2018. And then moving on from there, this is the actual 2013 Neighborhood Vulnerability Index, which is the same, exact same methodology as the 2018 and the same layout on the map, except that we used only 2013 here for anyone that's interested in seeing what Tucson and Pima County look like in 2013 with the exact same factors. Finally, there's the methodology tab, which goes into far more detail about the actual methodology of creating the index. So like I said, we modeled this entire index after the Austin Uprooted study, which is a peer-reviewed study, and we as a group felt that it was a very good methodology and also easily replicable with future data. The key points of the composite score are there's 2 conditions that have to be met. As we said, there's 5 factors. A vulnerable census tract meets 2 conditions. First, it has 3 or more vulnerable factors. So if we go back to here and we click on a vulnerable one, that means 3 or more yeses in these 5 factors down here. Second, once it has 3 or more vulnerable factors, its composite score has to be greater than 0. So the composite score is an average of the 5-factor scores. What those scores actually are is a z-score, meaning it's the distance from the mean of the metropolitan statistical area, which is Pima County. That means that the vulnerability of each tract in the Tucson area and Pima County is measured against the county as a whole, not the whole state. Not vulnerable does not mean that a tract has no vulnerable people in it. It actually means that the tract has a lower share of vulnerable people than the average. So that's something to keep in mind. So that's the walkthrough of the website, and I think that Liz would like to open it up to questions.
Thank you, Dr. Kim, for that.
Thank you, Dr. Kim. This is Mayor Romero. Thank you, Director Morales, for working on this important work. I know that there's been a lot of time spent on this work, and so I really appreciate the partnership between the City of Tucson, Pima County, and the University of Arizona with Dr. Kim's and Dr. Hammond's input and leading this effort. Are there any questions from my colleagues on the council?
Hey.
I believe there's Councilmember Fimbres and then Councilmember Kozaczek. And then Lane. Councilmember Fimbres?
Who developed the neighborhood vulnerability index? Can you tell me? Can you hear me?
Yes. Mayor and Councilmember Fimbres, I can share with you, and I'm getting to the answer to your question. The Neighborhood Vulnerability Index was a collaboration between Tucson and Pima County, and also the University of Arizona. The methodology was developed originally by Dr. Lisa Bates, who's a professor at Portland State University, and it's also been used by other cities, including City of Austin.
Okay. And under education, why did they only look for college degrees and not even GED or high school diplomas?
I will defer there to Dr. Kim to be able to provide some information on that.
Dr. Kim?
So the main goal was to model this after some previously created indexes that are used by other municipalities. So to do that, we used the same indicators that they had used before. The justification for using or not including education other than completed college education is that workers lacking a college degree are more likely to be unemployed or to be employed in lower wage, part-time, or seasonal jobs. So those jobs are the ones that are, or this kind of employment situation makes these workers more vulnerable to mass job loss. For example, what people are experiencing now.
Okay. And can you, one more thing, if there was no business growth, the same report lists Tucson MSA's real GDP as up 3.6% better than Salt Lake City, El Paso, Colorado Springs, Albuquerque, and the U.S. average. How so?
Dr. Kim, do you want to answer that, or I can answer that?
Yeah, one of you.
I believe Dr. Hammond would have the best answer to that.
Yes, I believe, thank you. I believe what we're seeing in that combination of data points for business growth and real GDP is the idea that existing employers were likely increasing their output and employment. which is something that can sometimes happen. We can have the same number of businesses in the economy, but they employ more people and produce more output. And I believe that's what we saw in 2018.
Okay, thank you, Doctor.
Thank you.
What else?
Are you good? Councilmember Fimbres?
Yes.
Okay. We have Councilmember Kusacek, Councilmember Santa Cruz, and then Councilmember Durham.
Just a real quick question for Alicia, and that I think that the tool is really valuable, and I appreciate how interactive it is and all the information that's contained in it when you click on a particular region. I just want to confirm though that the data that's reflected in this particular tool is current as of 2018. Is that correct?
That's correct. All of the data used in the tool comes from the 5-year Census ACS, which is the American Community Survey. The most current data available is the 2018 data. So the 2019 data won't be available until the end of this year or possibly January of 2021.
Okay. And when do you feel, well, you might have just answered it within that answer, in order for us to get a snapshot of the impact of coronavirus, would that be in the next data set or the one following that?
No, the next data set will be for 2019. So 2020, the 2020 ACS, which is currently ongoing, they're collecting the data now. The data won't be released until December 2021 or January of 2022, notwithstanding any delays that might occur because of the current situation.
Okay, and final question is, do either of you have a sense as to how long the economic impact we're facing right now might linger, and if there is a resurgence, what might that do to the rebound?
I'll let Dr. Hammond answer that.
Yeah, thank you. There's just a lot we don't know about how the outbreak is going to progress going forward. So there's a large amount of uncertainty about the shape and speed of the recovery. If we can avoid a resurgence of the outbreak in the fall, I think that the recovery will progress in a solid, steady fashion, with us getting back to pre-outbreak levels of employment and output, sometime in 2021 or 2022.
Have you reviewed Mike Ortega's and Joyce Garland's budget projections, and if so, do you feel that they're reasonably conservative enough?
No, I haven't reviewed those.
Okay. For city manager, I'd be interested in getting Dr. Hammond's feedback on your and Joyce's projections for recovery.
We're happy to do that, Councilman Kusacek. We'll get that over to him.
Thanks.
Councilmember Santa Cruz.
Hi, yes, thank you, Mayor. My question was to kind of go back to what Councilmember Fimbres had brought up about the 4-year degrees as an indicator. I guess I just wanted to reiterate that that there are other kinds of degrees, whether they're technical degrees or associate degrees, that I feel should be taken into consideration. We realize all the challenges and obstacles for getting a 4-year degree, but that I feel like folks in our communities have figured out ways to make things work for them. Especially, I have a lot of small business owners who never went to college, and had been doing fine. So I want to make sure that they're also not getting classified, and as vulnerable because they don't have a college degree. It just seems a little bit elitist and classist to think about it that way. And then just because you have a 4-year degree, I have a PhD, and it's still very challenging, to get a job in an educational institution. So I just wanted to put that out there as a way to maybe think about that. I understand that these are tools that have been used by other peer review studies, but I just want us to make sure that we're being critical about that piece.
Mayor, Council Member Santa Cruz, thank you for your input on that. And often it's about the perception of the words that we use, right? So by identifying the degree level, that really is just a data point that has been determined to be a kind of a measuring point. So definitely understand what your concerns are on there. But again, we're following the model that was the Uproot study.
Any other comments or questions, Councilmember Santa Cruz?
I have questions later on in the presentation.
Okay.
I have one follow-up.
Okay, Councilmember Durham withdrew his questions. Councilmember Fimbres, I believe I heard you speak up.
Do we have the professor at the university, Dr. Hammond? Do we have a set definition for gentrification that can be utilized? We get that thrown at us a lot.
Not to my knowledge. I will ask Alicia to chime in if she's run across anything in the Uprooted study.
I would have to go back. We would have to get back to you on that with the language used in the Uprooted study, because we are not using the NVI as a measure related directly to gentrification, but rather as an index that would tell us how vulnerable communities are in response to any hazard event. For example, the hazard event that is ongoing at this moment, right? So a hazard event could be a natural disaster, it could be an economic disaster or a public health disaster, or any combination of those kinds of things. So that was the purpose of creating the vulnerability index for Tucson and Pima County.
Okay, how about for displacement? Do we have?
No, we have not formulated a formal definition of that in regards to this study, but I'm sure there is one, and I think we would be able to get back to you with one.
Okay, and then this for Liz, the Poverty Never Stress report that also is included in this. When are we going to finally get the final copy that had all the indicators that we requested that it used to be in there, completed?
Mayor and Councilmember Fimbres, as you know, we have created a hands-on website and a report that has a lot of data information. I understand that some of the aspects of it does look a little different from the past report, so I've been directed by the city manager to come back to mayor and council possibly on May 27th to present the final report and information. But although it's in final status, it can continue to be updated and added to based on feedback from mayor and council and from our nonprofit partners. So we will be also doing a demonstration with our nonprofit partners on May 26th, so we can get that feedback from them. But we will. Yes.
Can you send us a list of some of the nonprofit partners you have? Because we have some faith-based people that have used this consistently when they're writing to other sources that draw resources into the community here to help feed and shelter some of our most vulnerable, most needy citizens. So if you can let me know, and then we'll make sure we invite them to also on that event that day.
Councilmember Fimbres, we would love to include anybody that you would recommend, and we will invite them to that demonstration.
And they'll be broken down by ward, right?
Yes. So right now, the way the website has story maps and also a written document, both the story maps and the written documents have the information broken down by ward, and it breaks it down for each of the indicators that have been in the past reports. Which is
crime, income, poverty, education, and housing.
Yes, and right now the crime is not in there because we are currently, and we should have that updated and input by the end of this week or early next week.
Okay, so as soon as you get it, let me see it, because we've had a jump in some things going on in my ward, and I want to make sure that we're talking to TPD right now. And then we have the Motorcycle Safety Council that's hitting me up about the motorcycle fatalities that are coming now that we've seen an increase in. Thank you, Liz, for your work.
Thank you.
Thank you so much, Councilmember Fuentes. And Dr. Kim and Dr. Hammond, thank you so much for your work on this vulnerability index. I appreciate it. I think that because it's such an important study of census by census or census tract by census tract in the city of Tucson and Pima County, it will be a very valuable tool to use specifically for what you've outlined, Liz, on your memo about it, in terms of allowing for geographically targeted strategies to direct resources, policies, and programs to best meet the needs of unique areas in our city. And so, unfortunately, I see vulnerability throughout the city of Tucson. This doesn't leave anyone out. There are greater amounts of vulnerability as I see the map in certain areas of our city. And so this is an amazing tool that with the help of the university, specifically Dr. Kim and Dr. Hammond, will really help us use this tool to start making decisions based on fact and on need for the programs that we have in front of us for the city of Tucson. I've always said that the more facts we have on the table, the more information we have on the table, the better we policymakers can make decisions for the benefit of the most vulnerable in our community. So I appreciate all the work. I understand, Liz, that this is phase one of the project. Can you talk about what's next, what the next phases are?
Yes, Mayor Romero, thank you so much for that. I did want to make sure I highlighted the next two phases. I also wanted to give a thank you to Corin Manning with PDSD and Chineka with the city manager's office. They were both very instrumental in moving this forward. And of course, Pima County joined us and have been very, very helpful and providing great input. We do have two more phases. The second phase is a housing market study. This will be working again with Allard College and Dr. Kim, and it will be pulling in information both on renter and homeowner information. It will be able to provide us a lot of data, and that will actually be more real-time information, and will be much, like I said, real-time compared to what we're dealing with the ACS. And then the third phase will be a gap analysis when we're looking at all these indicators as far as what are the needs for housing and how much more housing would we need to develop, among other factors.
Director Morales, I wonder if any of the information in terms of what's happening to the economy now can be factored into the following phase 2 and phase 3. Would that be possible?
Mayor Romero, I would tell you that yes, especially on the phase 2, I think we will have better information. Phase 3 on the gaps, we'll be looking probably at some ACS data. So I'm not sure on the phase 3. We can get back to you on that to let you know if that will be more indicative of what's currently happening, but I can tell you in talking with Dr. Alicia Kim that the Zillow, we're going to be utilizing Zillow information, which will be very current.
Okay, alrighty. I just wonder if, we started in some areas of the city being vulnerable, and with this pandemic and what the economy is doing to so many working families in our city, I just wonder if that is going to be part of the study as we move forward.
Mayor, we will definitely consider all those factors, and we will be providing you regular updates as we learn more.
Mm-hmm. One last question. How much was this a partnership, a grant to the University of Arizona? And how much did it cost? And was this a shared cost with Pima County and the city of Tucson?
Yeah, Mayor Romero, I can tell you a little, I can answer in part. I don't know that I have the full information. I do know that the full study was an agreement with University of Arizona. The amount was in the vicinity, I believe it was $30,000. I'm not sure about the shared cost, so I'd have to get back to you on that. But that again was through the PDSD is who completed that contract with Eller College.
Alrighty, any other questions?
No one else is in the queue.
All right, no one else is in the queue. This is great and important work done for the benefit of the residents of Tucson, and I look forward to seeing additional information. Really appreciate your work, Dr. Kim, Dr. Hammond. Thank you for your work on this, and I look forward to our continued partnership.
Thank you, Mayor.
Thank you. We look forward to it as well.
Thank you so much, Dr. Hammond. All righty, thank you, Director Morales. Now we're moving on to the next item on the agenda, which is actually item 14. Because item 13 has been continued at the request of staff, and so we're moving to item 14. Time has been set aside for discussion of the 5-year consolidated plan and actual plan. Mr. City Manager.
Thank you, Mayor. I'll just turn it right over to Liz Morales to talk about this is the annual conversation that the Mayor and Council has about the action plan and the comp plan. Liz?
Yes, thank you very much. Madam Mayor, we want to discuss the overview of the 5-year consolidated plan process. Typically, we come for the annual action plan, but this year we were tasked with having to develop the full 5-year plan. This final deliverable has been a result of much research of community needs and market analysis. In coordination with Pima County, we obtained significant input from residents and stakeholders and incorporated in the priorities that were outlined by the Mayor and Council retreat in January of this year. As a recipient of federal funds from the U.S. Department of Housing and Urban Development, the City of Tucson is required to submit the consolidated plan to HUD before any funding can be awarded. The actions you'll be taking today in the regular agenda will move us forward for us to be able to submit the application to HUD. I think it's important to note that Mayor and Council can always amend the priorities and activities as we determine where the needs are on an annual basis. We know that this pandemic will have an impact, and to what degree we cannot predict, but with data from sources like the NVI that we just spoke about and the Poverty Urban Stress Report, Mayor and Council can strategically make informed decisions on policy and how we want to invest the federal funds through the annual action plan. I'm fortunate to be joined by Martina Kuhl, who is our consultant. She's done a tremendous job in collecting and synthesizing this information. Martina will provide a brief overview and PowerPoint presentation, and I believe she should be on.
Good afternoon, Mayor and Council. Hi, Liz.
Hello.
Hi. I'm going to try sharing my screen here, and hopefully you will be able to see the PowerPoint. Bear with me. Are we seeing the PowerPoint?
Yes, I see.
Okay, excellent. Thank you. Thank you. So good afternoon, Mayor, councilors. I'm going to be brief to allow some time for questions today. Before I go into what's in the 5-year consolidated plan and the annual action plan, I want to mention that there are 2 companion documents that go with the consolidated plan. The first is called an analysis of impediments to fair housing choice. And that document basically is part of your requirement to affirmatively further fair housing. And it goes into some extensive review of discriminatory housing practices or the potential for discriminatory housing practices following HUD's guidelines. The second companion document is called a Citizen Participation Plan. That plan lays out how the city and county together as the consortium are going to consult with the public and stakeholders, provide adequate public notice, and include citizen and stakeholder comments in the plan. That particular document was recently amended to allow for virtual meetings under the circumstances, and also for a shortened public comment period on any new documents that may be coming out. And that document needed to be as part of the public hearing. Those are the only two changes that were made to the citizen participation plan. So in terms of the 5-year consolidated plan, I'd like to remind you that it is an application for HUD community planning and development resources. So that's strictly community development block grant, the Home Investment Partnership Program, the Emergency Solutions Grant, and the Housing Opportunities for Persons with AIDS program. So those 4 programs are covered in the 5-year plan, and they equate to roughly $10.4 million annually. The allocation, as you know, varies from year to year. Accompanying the 5-year consolidated plan are the annual action plans, which you hear about every year. And that's basically, how are we going to use the money that we're getting this year, and how do those planned uses tie back to the 5-year consolidated plan. So the priorities and goals that are established in the 5-year consolidated plan are important. It's important for them to be broad enough yet focused enough to allow us to invest those resources, especially given changing conditions, which would change under normal circumstances and are certainly changing rapidly today. There's 5 elements in the plan: the consultation and citizen participation. There's a needs assessment and a housing market analysis. And those 2 pieces use data that HUD preloads into their consolidated plan template. We also have other data that we have to look at in order to answer HUD's questions, but it looks at housing and homelessness, special populations, and non-housing community development. The strategic plan, which is what I'd really like to focus on, discusses the priority needs. Those needs kind of flow out of the consultation, the needs assessment, and the housing market analysis. It includes the goals for what we anticipate in HUD CPD funding, and it talks about strategies to address the elements that the plan requires. And this time only every 5 years, the first year annual action plan is included in the consolidated plan. So Liz mentioned that we did an extensive community outreach. We held 9 community forums. We had 2 follow-up meetings, one with homeless providers, one with affordable housing developers. We did an online survey, which nearly 800 responses is quite remarkable. We had a public comment period, 30-day public comment period. I would note that we received no written comments or other comments. And then this public hearing today, Pima County Board of Supervisors actually did theirs on the 5th, so they are approved and ready to go. The priorities that came out of our consultation and our survey, I cross-referenced all of that information. Focus on rental housing. There's an obvious need for assistance for renters and for more rental housing, owner-occupied housing rehab. In terms of homelessness, permanent supportive housing, preventing homelessness, and low barrier shelter were focuses. Special populations, people identified as seniors, youth, and people with disabilities. In economic development, the discussions revolved around micro and small business assistance and employment and job training services. Facilities, infrastructure, and public services is generally the biggest category of possible activities, and you can see on the slide here that there was a broad range of those, ranging from health and mental health care to transportation and transit to broadband infrastructure. And then there was a lot of discussion about capacity building, leadership development, and working more collaboratively with the healthcare and the mental health care sectors to address particularly the needs of our most vulnerable residents. So I want to touch very briefly on the needs assessment slides. I can always answer more questions. There are over 100,000 low and moderate income households in Tucson, and all of the consolidated plan resources have to be focused on low and moderate income households or people or special populations. So that's a significant number. It's a lot of people that we can potentially help with these resources. The other big thing that really came out of the needs assessment was the increase in chronic homelessness. Of course, things have changed a lot, but what we were seeing when the data was analyzed was particular chronic homelessness, long-term homelessness among people with serious mental illness and chronic substance abuse concerns, and it's clearly related to the need for affordable rental housing and lower wage employment. So what I want to mention in this housing market analysis slides is essentially that home values, when we're talking about homes that are owned or that might be purchased, increased in Tucson at roughly 6 times the rate of income just between 2015 and 2017. So we were actually approaching the high that we had seen before the economic recession. Rents likewise went up 12%, so about double the rate of income just in the last couple of years. The consolidated plan, the data that HUD gives us is 2015 data, when there was obviously conditions that were worth examining further. 2017 5-year American Community Survey data was reviewed to help kind of drive the point home to HUD that, you know, this is not perhaps as small of a problem as it might appear given the data that they provided. So we have about 20,000 low and moderate income unit owners countywide who are paying more than 50% of their income, monthly income, for housing costs, and another 16,000 paying more than 30% of their income. Most owners, or many owners, are older householders, which is just the way the market works. As we get older, we tend to be more likely to purchase a home. Renters, there are far more renters who are having housing problems. The severe cost burden, that paying more than 50% of income for rent, is impacting nearly 35,000 renters countywide, and 25,000 additional renters are paying more than 30% of their monthly income for rent. So we did do a gaps analysis just based on those severely cost-burdened renters, and looking at folks who are making less than $20,000 a year, where an affordable unit would be less than $500 a month. We are seeing a need just to house those people affordably of over 17,000 units. And that is quite a significant number. About 13,000, 14,000 of those are in the city of Tucson. Some of those, of course, are student units, roughly 7,000, but we're still talking about, you know, a need for 10,000 affordable rental units. So the priority needs that came out of the analysis and the consultation are community sustainability, human and public services, decent affordable housing, homelessness, economic development, housing and services for persons with HIV/AIDS to capture those HOPWA resources that we get from HUD, and program administration. Program administration is in here as a priority need because the way that the system, HUD system works, in order to get funding for something, it has to be linked back to a priority need. So some of the other things that you are well aware of in terms of other Tucson goals and objectives beyond those that I'm going to describe in just a moment are creating and filling some of those positions, particularly to address homelessness, the Vulnerable Neighborhood Index, and Poverty and Urban Stress Report that Liz just got done talking about. Really looking at how to coordinate and dedicate funding to better prevent eviction, because eviction was a huge issue, and I don't think that will go away. And then the Housing Commission, which I know is on one of your future agendas. So if we look at the resources that are coming through the consolidated plan, the largest resource is the Community Development Block Grant. We're looking at roughly $28 million over 5 years, $5.6 million this year. And what you can see in this particular slide is that community facilities and improvements, so that can include everything from infrastructure improvements to parks improvements, and demolition and clearance is the largest piece of the pie, if you will, in terms of the goals. Rental housing acquisition and rehabilitation for obvious reasons, as we just discussed. Human and public services. CDBG has historically been limited to 15% for human and public services. This plan keeps that cap for the moment. And then during this coming year, looking at some facade improvements for 5 businesses. There's also a micro business assistance mentioned in the plan as a 5-year goal. However, it's not included in this first-year plan because those types of programs are quite challenging to develop and deliver well using CDBG resources. So the discussion was we needed to take some time and make sure that we had that lined out so that we were in full compliance with HUD's requirements. So the Home Investment Partnership Program, fondly known as HOME, is the reason why there is the consortium and why you do a joint plan with Pima County. Without that consortium, you would neither of you have access to these resources. So the HOME program is will be about $12.5 million for the city of Tucson over the next 5 years, about $2.5 million this year. There's roughly a 70-30 split with Pima County. HUD sends a spreadsheet once a year and says, this is your split. Within this program, there's a mandatory 15% set aside for specially formed nonprofit organizations of 15%, and they can do only development activities. So they can develop rental housing or develop owner housing, but they cannot go in and say do owner-occupied housing rehabilitation or tenant assistance. Rental housing is the primary planned use of Tucson's home funds, really looking at the biggest chunk of that, of the home funds of this year going into rental housing. That would include acquisition and or rehabilitation, new construction, tenant-based rental assistance. The city has historically used its tenant-based rental assistance for security, utility, and move-in assistance. So that is the continued plan for that. And then also setting aside approximately 20% of the funds for owner housing to include first-time home buyer assistance, the development of new units, and substantial owner housing rehabilitation. But that's Pima County. They're down at the bottom there. And then finally, we have HOPWA and Emergency Solutions Grant. HOPWA is roughly $750,000 a year, about $3.75 million over the course of the 5 years. That program is administered by the Southern Arizona AIDS Foundation. They're what's called the project sponsor. So essentially what happens is the city takes their 3% to administer the program, do all the HUD reporting, take care of all the planning, et cetera, and the drawdowns for that program. And then SAFE plans to provide tenant-based rental assistance, support services, and housing assistance to roughly 200 households during the coming year. And then the Emergency Solutions Grant, that will be about $485,000 this year, roughly $2.4 million over the 5 years. There's a 7.5% administration that's retained by the city, and these funds are distributed through the Human Services RFP that you typically issue in fall. And the goal with those resources is to provide operating support for shelter, rapid rehousing, which is getting people who've been experiencing homelessness into permanent rental housing, outreach and services, and prevention. So what comes next? We have this meeting today, and anytime after approval is received to submit the plans, there's some certifications and other forms that need to be completed. And we can then submit the plan. As I mentioned earlier, Pima County has already approved submittal. So I will turn it back to Liz. And Liz.
Thank you, Martina, for that presentation. Mayor, I'm happy to answer any questions.
Thank you, Director Morales. Really appreciate your time and really appreciate the time invested by our consultant. I'm sorry, I don't, and Andrea, I think it is.
Martina, yes.
Thank you so much for your time, or Martina. Yes, I was looking at another box. Really appreciate your work on this. I think that this particular mayor, and I know my colleagues on the council, are really looking into how we restructure the thought process that has been put behind the consolidated plan and the annual plan. For me, personally, I think that Housing Community Development Department is one of the most important departments that the city of Tucson can manage. And so I'm intimately involved with these discussions. Back in January, in our mayor and council retreat, I heard all my colleagues on the council expressing interest in terms of how we approach poverty and need in the city of Tucson and in Pima County. And I feel that for far too long, we as a city have been focusing on attending to poverty, just taking care of the consequences of poverty, right? Attending to homelessness and sheltering, attending to the consequences of poverty, but not really looking at the root of the problem and what is causing poverty in the city of Tucson, and how we can hit at that root with these funds and in cooperation and collaboration with the Housing Community Development Department and, of course, Pima County. And so I want us to think about the 5-year plan differently than we do from previous years. And I want us to think about the action plan as a 1-year action map to get us to our goals of lifting people out of poverty in the city of Tucson. So I guess my first question is, does the annual action plan not address actions that we can take to address homelessness this year? And if not, why?
Mayor, I may just defer this over to Martina, but I can tell you that the annual action plan definitely has in quite a few places where we would support those activities that would help address homelessness, hopefully end homelessness for many people. Martina, would you want to add anything on that? Okay.
She needs to unmute herself.
Yes.
Oh, yeah, she might be muted.
Sorry, I was muted by a third party. 100% of the ESG funds are dedicated to homelessness, be it prevention, be it operating support for our shelters. The programs say these are the things that you can use these resources for. So, you know, in order to get to the root, as you're speaking about, these resources might not be the ideal for that. There's an opportunity perhaps to be creative with them, but HUD's pretty strict on what you can use the resources for. Likewise, CDBG, a portion of those will be used for to address homelessness, and historically have been used to also support, provide operating support for our shelters and for the people who provide outreach and help people navigate the complex systems.
Thank you, Martina. And I would add to that, you know, you do see every funding source having something to contribute towards homelessness. For example, under the home program, we have a tenant-based rental assistance support in which we provide move-in deposits for those who are homeless that are going into our homeless vouchers through the Section 8 program. So because our vouchers don't provide those move-in cost assistance, we use home for that. And under CDBG, we do support through our public service contracts a significant amount of funding for our nonprofits who are doing the good work to help those who are on either in shelters or on the streets.
And could you talk about, let me see if I'm unmuted. Can you talk about how the annual action plan links back to the Thrive in the 05 HUD funding and potential projects in the area?
Mayor Romero, I can tell you one of the things we did with our planning grant for the Thrive in the 05, we received a choice a planning grant from HUD, and we also committed to do 500,000 of CDBG funds towards that effort, and that falls under the community facilities. So if we need to do sidewalks or bus shelters, other type of other projects that would be eligible under CDBG, we are committing to that. So the work that we want to do in the Thrive in the 05 is definitely in the overall plan to be able to support the work that we'll be doing.
Alrighty, since I didn't really see a line item for that. Yeah. The core civic property purchase, what is the plan to activate these properties fully, and what is the schedule and funding source for that property purchase?
Mayor, so as you mentioned, the core civic purchase was done with within the last couple of months with CDBG funds. We do hope to continue to support that project to address youth homelessness, and also we're looking at how else we could address the gaps of homelessness. So we're in the process of identifying the needs. So is it best to utilize the facility maybe for families? Should we use it for our TPD and TFD that identify homeless individuals that maybe can't get them into shelters? So we're currently evaluating how to best use these properties. We also plan in the next few weeks to start reaching out to neighbors and residents to get their input about how to utilize these properties and let them know some of our initial plans. And we also would like to see if we can use one of the core civic properties for cooling station. Again, none of this is finalized. We still need to get neighborhood and resident input and talk to Ward 3 about the uses of that property. But we do plan to use that to help either through some type of shelter, transitional housing for youth, and also other homeless populations.
Do you have a target timeline to activate these properties, especially because the needs are now, they're very present? And so do you have an action plan and timeline to activate these properties?
Mayor, I can tell you that we do want to activate these properties within 6 months and sooner if possible. Staff just went and evaluated the property and what kind of needs it might need to fix it up. We do need to address costs. One of my hopes is with the CARES Act funds that we can use some of those for operational use, at least through the end of the year, and then identify additional federal funds to be able to operate those sites. I will tell you, with the youth homeless demonstration grant that we received, the city of Tucson did, we do have funds to do the operations to house the youth homeless. We are doing an RFP with providers to see who will be awarded those funds. That is through TPCH. So we do know that will be activated probably around October to December this year as well.
What I wanted to know, I think we talked about that, the core civic property purchase, but was this something that Mayor and Council acted on, or did the staff at Housing Community Development make an administrative decision on how to spend that CDBG money?
Mayor, we had funding under community facilities that was the community facilities funding line was authorized by Mayor and Council to do any, and within that ability was to do acquisition. And as you know, we needed to be able to spend some funds in order to meet a HUD deadline. And in coordination, we did talk to various the mayor and council members just to let them know that that was our intention. And it did not require new council approval. So we were able to act and spend those funds on those purchases.
We have some of my colleagues on the queue. I do have more comments, observations, and questions, but I will open it up for my colleagues on the council. In the queue are Council Member Lee, followed by Council Member Kozachek, and then followed by Council Member Santa Cruz.
Thank you, Mayor. Just a quick question for Liz. Liz, I know, first of all, I want to thank you for all of your hard work on this. I know we met a couple times to talk about this, and one of the issues that I brought up was just homelessness relative to veterans issues, and I didn't see that come up in this document, so I just wasn't sure if that was in scope for this plan or if it's separate since it's through the VA. So specifically, I'm just looking for clarification on the Veterans Affairs supportive housing and how that plays or doesn't fit into this plan.
Mayor, Councilmember Lee, thank you for that. So throughout the consolidated plan, there is the homeless veterans is determined as a priority population that needs to be addressed. And so we are very much addressing that through our homeless funding and doing a lot of coordination with the VA and other service providers that come across those who are experiencing homelessness who are also veterans. The Veterans Affairs Supportive Housing is the VASH program. That's a voucher program. So that doesn't fall under the community development side of this effort, but it is very much work that we do on the housing side of the department.
Thanks for clarifying, Liz.
You're welcome.
Councilmember Kozachek?
No, go ahead. I'm good. Go ahead, the next person.
Councilmember Santa Cruz?
Thank you, Mayor. So I am now just kind of reflecting on some of the materials that have been provided, and I've been part of the conversations with HCD the past couple of weeks as well. And I, one of the questions that I think that we need to be mindful of, that maybe we need to perhaps include a glossary that helps consolidate a lot of the terms, because I know there were still questions from some of my colleagues on like what is the definition, or how are we thinking about gentrification or displacement? So I think it would be helpful if we also had a glossary so that we all kind of have a common language as we're talking about this, including like what we mean by vulnerability, so that we can refer to that. So that's I guess more a comment or a suggestion. And then the other piece is that in the NBI, you know, it highlights how neighborhoods most vulnerable end up having the hardest time when it comes to recovery during an economic recovery. So my question is, how are we thinking we're going to use this tool and implement it in our recovery efforts with the pandemic going on, and how we move forward from here?
Mayor, Councilmember Santa Cruz, I think that is very much a concern to make sure that we look at how our funding is addressing the high needs that we're addressing for our neighborhoods. So we do want, as we do our annual action plan, is to look at what we are seeing out of the data points, right? So the consolidated plan provided us the HUD demographic and information, but I think going forward, we do want to look at the NVI and the poverty urban stress to say, where are those vulnerable neighborhoods and how are we investing those funds, and making sure that we are doing that in consultation with mayor and council and your staff to make sure we're not missing any areas that really are in need.
So are we thinking of, what about the glossary piece for a lot of these?
Councilmember Santa Cruz, I will look at that to see if we can insert that at this point. We are very close to submitting the final, so I will, I say this jokingly, Martina told me to reminded me that we have a character maximum. So we will try to get those terms in there, but I will, the other thing I want to stress is that after doing the consolidated plan, for me, the next priority is to do the human services plan. To me, that includes the general funds and how we implement our public service funds from CDBG. I do think that that will be the document that will have a lot more ability to put the glossary, to put our strategies and our priorities that are very Tucson centered, centered around our residents and our vulnerable populations. And so we will try to get that in the consolidated plan, but whether we get it there or not, we will definitely include that in the human service plan too.
Thank you, Liz.
We have Councilmember Durham on the queue, and then I believe Councilmember Fimbres.
Yes. I just have a motion.
Councilmember Durham, and then I have additional comments and questions, and then we'll go to Councilmember Fimbres. Councilmember Durham, you might be on mute.
No, I'm not. I support the City of Tucson's 5-year consolidated plan and the annual action plan. Plans, I believe, continue to move forward toward mitigating Tucson's pressing housing needs. The 5-year plan is expansive, and I applaud city staff, especially HCD Director Liz Morales, for her leadership. At the same time, however, I find the 5-year plan to be so broad that I find it difficult to identify specific commitments on how the plan will be implemented. I would like to ask the city staff to keep mayor and council up to date on any future changes to the plan. I have 3 questions. How can we be sure that the new vulnerability index will drive CDBG funds to those areas in Ward 3 and other wards with the greatest need and under the highest stress?
Mayor, Romero and Councilmember Durham, I appreciate that. I do understand the concern about the plan being broad. I'm happy to get a little bit more detailed as we go along. I think there's an opportunity for us and working with the mayor's office, Ward 1 and Ward 3, conversation around developing a funding process for us to be able to look at data that we talked about with the NVI and looking at how we want to fund projects. So one of the things we've talked about is transparency. Community facilities has been one of those areas that in the last few years we've been funding as they come to us. We would like to change that and provide a funding process in which we evaluate the projects, prioritize them, and recommend them to mayor and council so that you can see how we plan to use the community service funds the same way we do a process for the human service and public services funds from CDBG. And in that way, we can demonstrate how the priority projects that we're recommending connect back to the NVI and Poverty Urban Stress Report and demonstrate that the data is driving the funding recommendations.
Second question, how can mayor and council continue to be engaged in the execution of the 5-year plan?
Councilmember Durham, the 5-year plan now, as we do the annual action plan, I do believe that mayor and council can stay involved as we develop, as I said, the funding process. When we come back later next year to do, or I should say later this year, we'll start the planning process for the 21-22 funds, and we will involve mayor and council on those planning and how we want to distribute those funds. And again, when it's time to do the next 5-year planning, we will, as HUD directs us to do the consultation piece, the planning process, selecting the consultant. Those are things in which we can include and ask for mayor and council support and input into that process.
Third and last question, will there be a scheduled plan to keep mayor and council updated as to how CARES Act funds will be spent?
Yes, Councilmember Durham, I do plan on setting up an update every 2 weeks for mayor and council staff who would like to be advised as to how we're moving forward with the CARES Act funds, how they're being spent, and any changes or updates related to those efforts. We do know we might even get more CARES funds in the future, and how we would need to come back to mayor and council to accept additional funds as well. This evening, you'll be asked to adopt a substantial amendment to adopt the current CARES funds that have been awarded for the current annual action plan. And I do plan on working with mayor and council as we drill down into how those funds are used, again, on eviction prevention, mortgage assistance, rapid rehousing, homeless shelter, and operations, and any other needs that we identify through this crisis that we are seeing people experiencing.
Okay, I'm done.
Thank you, Councilmember Durham. I agree with you in your comments that I'm concerned about the lack of detail in the 5-year plan, including on the homelessness piece. When we talk about the priorities, we've talked about, many of us on the council have talked about, and we talked about it at the retreat, how we want to see homelessness treated in the city of Tucson. And for many years, we have given out funds to shelters without thinking about what are the models out there that are actually helping people leave shelter, right? Shelters are very temporary. And so how is it that we focus on not just sheltering people, but actually helping them move beyond their homelessness and helplessness? And so we talked about creating a housing first position within the city of Tucson. And look, Liz, I really appreciate all your work as the director of housing community development. I think that working together, we can really do amazing things. But as of now, I think you inherited a department that was in disarray. And I've been very clear about that publicly, about my concerns regarding the Housing Community Development Department. I don't agree that we should purchase pieces of land without having plans for them, without thinking we need 70 units for homeless youth. We need 17,000 units to help working families that are paying more than 30% of their mortgage. We need to be able to do better. The city of Tucson is the housing authority for both Pima County and the city of Tucson, and we must do better. And so we have an opportunity with the 5-year plan, with every annual plan, to do better. We've returned federal housing vouchers before, not under you, but I think we have failed in terms of our housing community development planning and moving from what we used to do 20, 30 years ago to what we need to do now, and following best practices and housing models that will move our community from poor and vulnerable and homeless to the next level of their life. That's why I believe that the housing department is so important. I understand, Liz, that the city of Tucson is now on a work plan from HUD, and is required to address all items by June 30th. The work plan identifies issues associated with our governance and how we govern in our housing authority. It also talks about low rent public housing vacancy days, and that our wait list process ensures a proper management process that is fair and equitable, that wait list is too long and the protocols are heavy, and that the current 2020-2024 5-year action plan does not reflect specific work, projects, and required information for us to be able to accomplish the goals of that work plan, that they lack specific project impacts to our public housing authority and its ability to obligate funds within a timely manner. The work plan from HUD requires additional attention from mayor and council. And I believe we all received a letter from HUD explaining to us that HUD was putting our housing authority under the work plan, and we, mayor and council, really never got the opportunity to discuss this work plan and examine what approaches we take to develop the concerns outlined by HUD in the work plan. So I am committed to working with your department and with the city manager to really work on this work plan, because it really concerns me that HUD might be looking at the city of Tucson and our housing authority and possibly having the city either return or not get sufficient funds for our housing authority and our department. So we talked in January in our mayor and council retreat about how we move from what we've done, from what you inherited when you came in as a director, to where we need to go, where we need to move as a city to have a working plan, a 5-year plan, annual plan, and a working public housing authority. I agree that the information that you have in front of us, you do call out for the CDBG funding or the total funds that we're receiving, you do call out specific lines in terms of community facilities and human and public services, decent affordable housing, but you really don't call out what projects and programs those funds are going into. I think what we need to do in partnership, the mayor and council, the Housing Community Development Department, is make sure that based on the direction that we gave you in January and the continued conversation that we're in, that we have to create a housing first position in the city of Tucson, that we need to coordinate with city department efforts and put into practice best practices that reduce homelessness. That we need to utilize specialty vouchers such as veteran vouchers to assist people experiencing homelessness, and that we put home funds to provide move-in assistance to our community. That we need to expand programs like Old Pueblo Community Services Homeless Work Program and invest those funds into, instead of doing 4 days a week, doing 5 days a week, utilizing our funds from CDBG and other funds in the city of Tucson. So what I see as Councilmember Durham has mentioned, I see a lack of detail. And I want to make sure that mayor and council gets to help you put detail to those plans. We need to do better. We need to make sure that we have a functioning housing community development department, and we need to get you the help that you need. That's why we had talked about housing first positions and housing navigators, and make sure that you get to select your deputy director, because that's a big department. So what I wanted to know along the lines of Councilmember Durham's questions is, how are we going to invest the CARES Act money under CDBG, under emergency solutions, and what are the details to that? Can you come back next week? I know that we have to talk about the annual action plan and the 5-year plan during our regular session, but can you come back to us, mayor and council, starting next week, to talk about the CARES Act funding and how we plan ahead? Because right now we have $5.9 million as of now in CARES Act funds, additional to the $5.6 million that we usually receive. How are we going to plan to use those CARES Act funds? And we can help you put that detail, that meat on the bones of the CARES Act funds. Can you come back on the 27th as well, so we continue talking about the CARES Act funds?
Mayor Romero, I'd be very happy to do that. First of all, thank you for your leadership on this and your commitment to supporting the department so that we can make the biggest impact in the community. And I share your commitment to this and really seeing HCD become a very high functioning and impactful department for our community. And I definitely have some things ready to share with mayor and council on the finer details of the CARES Act funds. We will do the same with when we are talking about this annual action plan. We will make sure that the detail is there and that mayor and council is comfortable with before we move forward with funding any new projects.
Thank you, Liz. I am committed to helping, and we want to make sure that we have a thriving department that really hits at the root of the poverty issue here in the city of Tucson. So with that, I'd like to send it over to Councilmember Fimbres.
Thank you, Madam Mayor. Liz, I want to commend you also for the work you've done, but your hands have been tied for a bit, and I know that you've been short-staffed, so we want to make sure we give you the tools that you need, and I'm committed also, I know, with my colleagues on the council, but I have a motion. I would like to move the city manager and direct staff to do the following. Bring back to mayor and council the following in the next 30 days. A draft proposal to include the metrics HCD would use as a baseline to define progress related to housing and an update on the status of work plan items indicated by HUD Arizona 004 and Arizona 033 dated May 1st, 2020. It proposed how HCD would increase communication with mayor and council with monthly reports on how funds are being spent by service providers and nonprofits that are to be assisting the community. A list of specific projects in the annual action report plan, including associated costs, schedule of projects, total project costs, construction costs, how they tie into the city's CIP plan, project management, and with HCD CARES funding. In addition, that moving forward, policies associated with the 5-year consolidated plan, the annual action plan, and the human services plan be amended to reflect the following. Any budget deviations from these plans be brought to mayor and council for review and approval, which is the policy of Proposition 101 and Proposition 407 approved by the voters. The Poverty Never Stress Index, the Vulnerability Index, and the general plan must include the 5-year consolidated plan, the annual action plan, and the human services plan. All city-generated data must be used in constructing future plans and must be shared with and used by consultants hired to perform work for the city, and that any federal deadlines associated with these plans must be adjusted to inform the consolidated plan, annual action plans, and the human services plan. That's my motion.
Second.
There is a motion and a second. Any additional discussion?
Mayor, not on that, but when appropriate, I'd like to make a comment.
Oh, absolutely, Mr. Ortega. Councilmember Kozachek.
Yeah, before I ask, so Richard,
yes.
Can you, without reading it, just kind of say in layman's terms in 25 words or less what it is that really is asking? Don't read War and Peace again.
No. Basically, we want to make sure that when we're having changes done with this plan, we need to be aware of it and make sure that we have a voice in what's happening and the direction we're giving, and making sure that, and I want to make sure that the HCD is given the staffing that they need, because, you know, you read the letter from the feds and it has some challenges for us. And those challenges we can really turn into opportunities to make this be a model for the rest of the country.
All right. Okay. So I don't think Liz would have any problem with it at all. Liz, I want to join Rahina and Richard in really giving you kudos for stepping up and really flipping the department around. We have tonight on the regular session item 8, the issue of HCD CARES allocations. So, Rahina, do we need to push that off to the 27th based on what you just asked of her, or what?
No, I think that we can, there's allocation under specific buckets, but no specific projects under those buckets.
Okay. So
I think
the $1 million in CDBG, what is that? For the 1.5
right.
ESP, what is that? All right, cool.
What, exactly.
Got it.
As I heard your motion as well, Councilmember Fimbres, it also talks about aligning the annual action plan, the 5-year plan, and the human services plan with the vulnerability index and the poverty and urban stress report.
That's correct.
Okay.
So it gives us good indicators of where we need to go and where we need to move in what directions and what wards are still lacking with services. The other thing I forgot to talk about was youth. There's a lot of homeless youth and a lot of folks that need direction. And I know that Youth on Their Own received a grant that we can partner with also to make sure that those people are getting services too.
Okay. I know that Councilmember Lee is on the queue to speak, and Councilmember Santa Cruz.
Thank you, Mayor. Just a quick question. with Liz's deputy coming on board, just curious, and this might be a question for the city manager, with the expectations, I did kind of get a little lost in the motion as well, and the timeline for what your expectations are, Councilmember Fimrace. So to Mr. Ortega, wanted to see just your thoughts on the expectation and the timeline for what's being asked. Any concerns on that?
Madam Mayor, Councilmember Lee, no concerns. Just so everyone knows, we have hired Terry Gilligan as our new deputy director. He's a good hand. I also will be reassigning Ann Chinaka from my office to assist Liz. Liz and I have chatted at length about what she needs in terms of some of the development opportunities there, and Ann from my office will be reassigned to her, and we'll go down that path. In addition, part of the redeployment of staff working with Liz, we've identified some folks that are going to be moved over to help her, and so we're going through that process now. We aren't able to just snap our fingers and move them, but I can tell you that we're working very closely to make sure we shore up Liz with whatever she needs so that she'll have the opportunity to be successful. And in fairness to Liz, we appreciate her as a team member. She did inherit a pretty challenging situation there, and we have seen nothing but great things from her, and we're going to continue to support her with all we can. That's all, Mayor. Thank you, Councilmember Lee.
Thank you. That's all I had, Mayor.
Thank you, Councilmember Lee. Councilmember Santa Cruz, I saw you on the queue.
It was an earlier comment, but I just wanted to reiterate what Councilmember Fimbres outlined in his motion, because my concern was that it seemed that the plans weren't informing each other, and I understand that like the consolidated plan is like a HUD requirement, but it also informs a lot of how we do our planning, and so I think the more transparent all these processes are to us and to the public, the better like we can inform ourselves and show up as well. And I know some of the conversations we were having about how do we have ongoing town halls with our communities around these plans and the impact that they'll have in our community. So I just wanted to say thank you for bringing that forward, and I look forward to really making sure that we're providing this information and it being informed by the community, because a lot of times there's a disconnect, and it gets really it gets very convoluted about what all these plans mean. So it's good to have like a scaffolding for them so that we better understand them, and then we can also share that with our constituents. So just thank you. Thank you,
Councilmember Santa Cruz. Liz, I'd like to know more about the work plan that I'd put our Public Housing Authority under. So maybe if you can come back next Wednesday, or maybe at the first meeting in June, the sooner the better, to explain to us what are the issues associated with the work plan and how are we going to advance the concerns that HUD put in front of us. I'm very concerned and really want to know much more detail and how we can act as mayor and council to help right that that concern, that wrong. Okay. So there is a motion and a second. Any further discussion? If there's no further discussion, may we go to roll call, Mr. Clerk?
Ms. Santa Cruz?
Aye.
Mr. Cunningham?
Aye.
Mr. Durham?
Aye.
Mrs. Lee?
You're muted.
Aye.
Mr. Fimbres?
Aye.
Mr. Kozaczek?
Uh-oh.
Mayor Romero?
My internet is going crazy. My internet is going crazy. I've lost the connection.
Okay to let him know.
Uh-huh.
We can still hear you, Your Honor.
Roger Randolph. This is Elaine. The mayor's internet has gone crazy and she's lost connection.
Okay.
Did that come through, Roger?
It did. Is she connected?
Got it. We got it. So we'll let's all hold set until.
If you can just give her a minute, she's trying to reconnect. Thank you, City Clerk.
What are you eating?
Me?
Yeah.
Oranges.
All right.
Do they have saladitos?
No.
Come on.
These are the sun-kissed navels, the really sweet ones. We bought like a dozen. I was eating
on my iPad, so I'm using Elaine's computer.
All right. We had while you were gone.
So sorry. Alrighty, Roger. I think all my colleagues voted.
We were waiting on your vote, Your Honor.
Okay, thank you so much. Really appreciate it. Aye. Alrighty. So the motion passes 7-0, or were there any nays? Okay. Alrighty, thank you so much. Then we move to item 15. Is there any national, state and national legislation original committee issues for discussion?
Yeah, Honorable Mayor, members of the council, Councilmember Fimbres asked a few questions on the Postal Service and some of the stimulus bills. We covered all that information as part of item 7 already under the COVID item, so I'm just happy to answer any questions.
I don't believe there are any questions in the queue. Thank you so much, Andrew, really appreciate it.
Madam Mayor?
Yes, Councilmember Fimbres.
I know that there's another surplus for $25 billion to help the Postal Center out. Has that got support from both sides, both parties? Or, because I hear that the president says that, and McConnell said that the new allocation is dead in the water, they're telling us. So I know the Senate, I know Senator McSally was working on something also for the Postal Center.
Yeah, Mayor Romero and Councilmember Fimbres. Yeah, as I said earlier, the HEROES Act got sent over to the Senate. The Senate has said that they're not interested in taking up that bill. That said, though, there are a number of provisions, including the Postal Service support, that does have bipartisan support on both the Republican and Democratic side in the Senate. So yes, and including here in Arizona, we've had good support from both Senators Sinema and McSally.
Yes.
So we do expect that the Postal Service will receive a lot of support as we move forward.
Okay.
So,
thank you.
I have a quick piggyback comment on that.
Absolutely. Go ahead, Vice Mayor.
Hey, did we lose the Rosemont post office? Isn't it up for closure? It's in Ward 6. And I distinctly remember going to a post office recently, and there was a sign up saying this post office is going to be closed.
Oh, wow.
So are we monitoring which post offices we're losing right now?
Mayor, Vice Mayor, I haven't heard about any potential closure of Rosemont, so I will follow up on that and let Mayor and Council know what I find out.
Thank you so much, Vice Mayor. Thank you so much, Andrew. Really appreciate it. All righty. So we're moving on to item 16. Does anyone have any items to remove from the consent agenda? I don't hear any complaints, so we will move on to item 17. Does anyone have any items for future agendas? Alrighty, so
Mayor,
I'm sorry. I think that
it's Councilmember Lee. Sorry
okay,
about that.
Go ahead, Councilmember.
I just didn't know if you were going to confirm the 27th time frame, morning, afternoon at this point for upcoming meeting.
I do not have that in front of me, Councilmember Lee, but so far what we're seeing for that particular agenda is the logistics for the We Are One Somos Uno workers, nonprofits, and small businesses contribution. And then we have another stab at our budget. I believe we're coming back with a Housing Community Development Department update on the work plan and the CARES Act funds. And then I believe one executive session that has been continued from today. So
do you know when we'll know what the timeline looks like for that, just for scheduling? Do you know when we'll know the time of that start for that?
I believe we can arrange that for tomorrow, Mr. Clerk. And I believe the city attorney also can jump in.
Your Honor, I believe we're looking at least 2 o'clock start time.
Okay.
Thank you.
Alrighty. So with that, let's convene the regular study session, and may I have a motion to move into executive session?
Moved.
Second.
So there's a motion and a second.
Your Honor,
Roll call.
Your Honor, before we do the roll call, I do need to read these for the record. Your Honor, the first executive session is noticed as item 1, executive session, potential purchase of Tucson Unified School District property located
in because my technology is really not great. We're going to have to take a look at this technology, Mr. City Manager.
Hey, while we're waiting, Roger and or Ortega, what?
A motion and a second. All those in favor signify by saying aye.
Aye.
Aye. Any against? Motion passes. What is the council's pleasure on item 1?
Mayor, I would simply ask
I'm sorry.
for
Is it item 1 or item 2?
Item 2, Your Honor.
Item 2, I'm sorry.
So for item 2, Mayor, I would ask for a motion directing the city manager and city attorney to proceed as discussed in executive session.
Is there a motion?
So moved, Your Honor.
There is a motion, and is there a second?
Is that the Metro building? Or is that Houghton Reserve?
That is the TUSD.
That's
okay. Second.
There is a motion and a second. Mr. Clerk, can you go to roll call?
Nick Santa Cruz.
Aye.
Mr. Cunningham.
Aye.
Mr. Durham.
Aye.
Mrs. Lee.
Aye.
Mr. Fimbres.
No.
Mr. Kozaczek.
Aye.
Mayor Romero.
Aye. All righty. What is the council's pleasure for item? I think we're not doing 4 because it was delayed. So item 6.
And Mayor, I would ask that the mayor and council direct the city manager and city attorney to proceed as discussed in executive session.
So moved.
Second.
There is a motion, and was that a second, Steve?
Yeah.
Okay. There's a motion and a second. Mr. Clerk, go to roll call, please.
Nick Santa Cruz.
Aye.
Mr. Cunningham.
Aye.
Mr. Durham.
Aye.
Mrs. Lee.
Aye.
Mr. Fimbres.
Aye.
Mr. Kozaczek.
Aye.
Mayor Romero.
Aye. Motion passes 7-0. We are complete with the study session agenda. Study session is adjourned. The regular session begins in 15 minutes. So you all can take a break and then come back for regular session. We will adjourn at 6:15 if that's okay, Mr. Clerk.
Yes, Your Honor.
Okay, so study session is adjourned. The next study session meeting will be on Wednesday, May 27th, 2020. The hour will be announced shortly. So we'll see you in 15 minutes, everyone. Remember to come back to this meeting.
Fimbres?
Here.
Mr. Kazachi?
The city clerk's office.
Thank you for bringing us to this meeting today, healthy and open-minded. We ask for guidance for the mayor and council as they make decisions that will affect the lives of all Tucsonans. Help to make these decisions without bias or prejudice. It is important to remember to do what is best for the entire community. We know this is not an easy task, but we ask for guidance in that which will benefit most people. Amen.
Amen. Item 2D.
Appointments to boards, committees, and commissions.
City manager's communication number 131 dated May 19th is
Community to receive our fair share of federal funds as well as to help to make decisions for roads, schools, hospitals, and public programs. Responses are confidential and they are received by you and our home across Tucson. Is compiled to produce statistics for Tucson. For more information, go online to 2020census.gov. On Memorial Day, as well as Veterans Day, my office has collaborated with schools across Tucson and Pima County to create thank you cards and letters for veterans who are at the VA hospital, which is located in Ward 5. On Friday, May 22nd, I will be going to the VA hospital to present the thank you cards and letters made by school children, by the veterans, for the veterans to thank them for their service. I want to thank all the schools and organizations that help to great thank you cards for our veterans and for Southern Arizona Hospital for again letting us give these thank you cards to those who serve our country. Anybody interested can let me know. We're just going to we're going to present them to the staff, and then they're going to distribute them. But you are all welcome to come and attend the presentation of the cards and participate in the photo op. On Monday, May 25th, our nation will mark Memorial Day, the day we remember those men and women of the military who sacrificed their lives for this country. I want to thank Councilman Cunningham and Councilman Lee for serving our great country. And I know Memorial Day is really for those who paid the ultimate sacrifice and gave up their lives for this great country. So I want to thank them for their service also. Thank you.
You're muted.
Mayor, you're muted.
We will go back to Councilmember Santa Cruz and then Councilmember Lee.
Thank you, Mayor. I just wanted to let our community know that Kennedy Park received approval from the Bureau of Land Management to host special events in the Fiesta area. And as we figure out what our new normal is moving forward, the park will be a wonderful community asset where people can host events like farmers markets, health and wellness fairs, concerts, and car and bike shows. I wanted to thank and extend my appreciation to Albert Elias, Andrew Greenhill, Tracy Tucker, and Greg Jackson for helping us navigate through this process and making it happen. Thank you.
That's great news, Councilmember Santa Cruz. We've been working on that for many years, and to be able to reactivate Kennedy Park is a wonderful news. Councilmember Lee.
Thank you, Mayor. Thank you also to Councilmember Fimbres, and thank you for your service, sir, as well as to Vice Mayor Cunningham. I will also be remembering along with you both those who sacrificed their lives on Memorial Day this year. I want to provide everyone with an update on our 3-part Ward 4 Summer Town Hall series. That's a mouthful, where each month we're going to be taking a different topic of core services and doing it virtually since we can't do it in person. We did have our first one scheduled for May 27th. However, since we will be having a special mayor and council meeting happening that day, we're going to be moving that to the end of the series to be held on August 26th. That will be with transportation. So our next one will be happening then on June 24th with TPD and Tucson Fire Department around public safety. Wednesday, June 29th will be Parks and Recreation. So you can go to our website, tucsonaz.gov/ward-4, as well as our Facebook page, and all that information on how to participate will be up there for you very shortly. Also want to give you an update on something our staff has been working on. As many of you know, Youth on Their Own is an organization here in Tucson, a 501c3 dropout prevention agency. who strives to eliminate barriers to education and empower Arizona's homeless youth to stay in school. Yodo has empowered over 16,000 homeless youth to remain in school and pursue opportunities for self-sufficiency to date. And personally, I've been a fan and a supporter of Yodo for several years now. And when COVID hit our community, I knew immediately that technology needs were going to be a big barrier for a lot of students in our community whose families might not be able to afford the technology to enable them to finish school. So at the same time, our team was in the process of planning the annual Shirley Scott Ward 4 Back to School Bash, and we immediately pivoted our efforts to focus on how we could help keep kids in school from a technology perspective. So we reached out to TUSD, Cox Communication, and Youth on Their Own to take a look at the needs and how we might be able to help. And in that process, we learned that a lot of the Youth on Their Own seniors lacked the technology to finish the final few weeks that they needed to get across the finish line and to be able to graduate. So we reached out through our office with really great public, private, and nonprofit partnership between our ward office, Raytheon, and Youth on Their Own. And Raytheon stepped up in a huge way to very rapidly get 30 laptops and accessories built and shipped for Youth on Their Own to enable 30 seniors here in our community to be able to graduate. So it was a great partnership. So I want to congratulate the Youth on Their Own folks who are going to be graduating this year and all of our 2020 grads here in Tucson.
You're going to teach them how to reuse a slide rule?
I don't know about that.
Okay.
That's
Madam
great.
Mayor,
That sounds.
Madam Mayor, I forgot to say thank you to Councilman Kasachik and Ann Charles, who are going to be helping us present 125 military veterans masks to the patients at the VA hospital also on Friday. So thank you. Thank you, Steve. Tell Ann.
Yeah.
Thank you. Thank you so much. Item 4.
Wait, I have a quick question.
Oh, yeah. So absolutely.
For either Rankin or for Ortega. Early on, we weren't streaming these meetings, but then we went on Facebook only. Can you kind of, as Mike Ortega, I guess, as a part of your item 4, tell us how this got streamed eventually, how the public, because we may get questions about it.
Mayor, happy to take on item 4 if you're okay with it.
All right. I think the clerk needs to read the heading.
Okay.
City Manager's Report, Summary of Current Events.
City Manager's Communication number 133, dated May 19th, is received into and made part of the record. This time has been scheduled to allow the City Manager to report on current events. Mr. Manager.
Mayor, thank you for the opportunity. Councilman Kazachek's question regarding streaming. We are streaming. Roger, I'm not sure that you can confirm the exact time, but I do know that the council was in session earlier, wanted to go on live stream. We were streaming it on Facebook early on, but then we went through the usual YouTube channel. Roger, can you confirm that under my report?
Yes, Your Honor, City Manager, we were offline for probably just a very few minutes before we actually began live streaming. So we were up very early once we actually did start the meeting.
Okay.
Perfect. Thank you, Mr. Randolph. Also, Mayor, members of the council, wanted to let you know that I have selected Jeffrey Yates as our business development service, our business services director. Will act also eventually as our finance director. Mr. Yates comes to us with CFO and finance director experience. Very excited. He has a couple of master's degrees. It will be before you for consideration on the June 9th agenda. So you'll get to meet him then if you haven't met him already. That's all, Mayor.
Thank you, Mr. City Manager. Really appreciate it. Also on that item, in terms of streaming the meeting, we also are recording the meeting, the study session and the regular meeting for anyone to connect to that as well if they need to. Item 5.
Liquor license applications report from City Manager.
City Manager's Communication number 134, dated May 19th, is received into and made part of the record. Mr. Clerk, please read the liquor license agenda.
Your Honor, in this evening's liquor license agenda, under item 5B, we have 4 requests for new license, 2 requests for person owner transfer. Under item 5C, we have no requests for special events. Under item 5D, we have 2 requests for agent change, acquisition of control. and staff has indicated that all the applicants are in compliance with city requirements, so an appropriate motion would be to forward items 5B 1 through 6 and D 1 through 2 to the State Liquor Board with a recommendation of approval.
May I have a motion, please?
Madam Mayor, I move to forward the liquor license to the State Liquor Board with a recommendation of approval.
Second.
There is a motion and a second. Any discussion? All those in favor indicate by saying aye.
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 Any opposed?
Aye.
That was
It was a late support.
it was a late support, yeah. So motion carries 7-0. Item 6.
Call to the audience.
Call to the audience has been canceled for this meeting. There's still a question remains that if we continue meeting via Teams, that we allow some way, shape, or form for the call to the audience for people to be able to submit their questions or comments, or figure out a way how we can let them submit their opinion to mayor and council. I believe the city clerk is working on that detail. Is that right, city clerk?
Yes, Your Honor, we are.
Okay, thank you.
Your Honor.
Yes, Vice Mayor.
So over the past 2 meetings, I've experimented with watching my screen on the Teams, and then I have one of my old laptops streaming our YouTube channel. And so I've been kind of watching our progress with how we can do it. And I think there's a way that our feed can have a designated square for the call to the audience members. And maybe we can figure out how we have guests in the meeting slide in as unmuted, and their video would go on. And then once their sound would hit, it would automatically hit Roger's screen. So I think there's some opportunity there, and hopefully we can resolve this in the next couple weeks.
Well, I think, Roger, correct me if I'm wrong, but the way the Teams works is the last 4 people who spoke are the ones who are on the screen. So the speaker would automatically pop up. Is that not right?
That's correct.
In the meantime, I believe that the city clerk has provided an email address, cityclerk@tucsonac.gov, where the public can send their email comments to mayor and council. All righty, we move on to item 7.
Consent agenda items A through K.
Reports from the city manager on the consent agenda are received into and made part of the record. Mr. Clerk, you are requested to read the consent agenda.
Yeah, and on this evening's consent agenda, item A is approval of minutes. Item B is Tucson Code, amending Chapter 10A, change of the attendance requirement for the Complete Streets Coordinating Council. Item C is a grant application to the Federal Transit Administration for Public Transportation Innovation Program funds. Item D is an intergovernmental agreement with Regional Transportation Authority of Pima County for the provision of fixed route transit services for designated areas of Pima County, the town of Marana, and the city of South Tucson. Item E is an intergovernmental agreement with Regional Transportation Authority of Pima County for the Bicycle Boulevard Package 1 Improvement Project. Item F is an intergovernmental agreement with the Pasco Yaqui Tribe for provision of fixed route transit service for designated areas of Pima County. Item G is an intergovernmental agreement with the Regional Transportation Authority of Pima County for regional transit service improvements for fiscal year 2021. Item H is boards, committees, and commissions extending the term of service for the Transit Task Force, amending Resolution 21023. Item I is a pre-annexation and development agreement with Roy H. Rogers Foundation, LLC, owner of parcel 140-01-026A for water service. Item J is employee benefits adoption of fiscal year 2021 Tucson Supplemental Retirement System employer and employee contribution rates. Item K is an intergovernmental agreement amendment with Pima County for street naming and address services. That's the extent of the consent agenda, Your Honor.
May I have a motion, please?
Your Honor, I move that we pass and adopt the items on the agenda.
Second.
There's a motion and a second. Roll call.
Mr. Fimbres?
Aye.
Mr. Durham,
Aye.
Mr. Cunningham,
Aye.
Mayor Romero,
Aye.
Mr. Kozaczek,
Aye.
Mrs. Lee,
Aye.
Ms. Santa Cruz.
Aye.
The items on the consent agenda are approved by a vote of 7-0. Item 8.
Public hearing, substantial amendment to the 2019 Annual Action Plan in response to the COVID-19 pandemic, hearing resolution number 23172.
City Manager's communication number 145, dated May 19th, is received into and made part of the record. Ladies and gentlemen, this time and place is legally advertised for a public hearing on a substantial amendment to the 2019 Annual Action Plan in response to the COVID-19 pandemic to include funding provided to the City of Tucson by the Department of Housing and Urban Development as a result of the passage of the CARES Act. This public hearing is scheduled to last for no more than 1 hour. Speakers are limited to a 5-minute presentation. Mr. Clerk, do we have any requests to speak?
No request, Your Honor.
Then I'd like to get a motion to close the public hearing.
Is the motion to close the public hearing?
There is a motion.
Second.
There's a motion and a second. All those in favor indicate by saying aye.
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 Any opposed?
Aye.
No opposition. So, Mr. Clerk, you're requested to read Resolution 23172 by number and title only.
Resolution number 23172 relating to public housing, approving the substantial amendment to the 2019 Annual Action Plan in response to the COVID-19 pandemic and declaring an emergency.
What is the council's pleasure?
I move that we pass and adopt the resolution. The resolution is presented.
That item is seconded.
So there is a motion and a second to pass and adopt Resolution 23172. Any discussion? Roll call.
Mr. Cunningham,
Aye.
Mrs. Lee,
Aye.
Mr. Kozaczek,
Aye.
Ms. Santa Cruz,
Aye.
Mayor Romero,
Aye.
Mr. Durham,
Aye.
Mr. Fimbres.
Aye.
Resolution 23172 passes by a vote of 7-0. Item 9.
Public hearing approving the City of Tucson Consolidated Plan, including the Annual Action Plan and the analysis of impediments to fair housing, hearing resolution number 23174.
City Manager's communication 147 dated May 19th is received into and made part of the record. Ladies and gentlemen, this time and place is legally advertised for a public hearing. The City of Tucson, Pima County 5-year HUD Consolidated Plan, 2020 analysis of impediments to fair housing choice and federal fiscal year 2020 HUD Annual Action Plan. This public hearing is scheduled to last for no more than an hour. Speakers are limited to 5-minute presentations. Mr. Clerk, do we have any requests to speak?
Yes, Your Honor, we have one request to speak. It's Mary Ann Scott.
Am I unmuted?
You are.
I am unmuted?
Yes.
Okay. I do hope my comments are applicable if it's talking generally about impediments and barriers to fair housing and not necessarily pointed towards COVID-19. So I hope I'm in the right place at the right time. First, I just wanted to say hello to Mayor Romero and council meeting members, and thank you guys for letting me have a few minutes of your precious time tonight. Having a daughter who's turned 18 and is a senior this year, I've become interested in housing options for her when she gets ready to leave our home. Like many others that fall into the same category as her in our state, we find in a situation where there are not many housing options for her. Solutions to this long dilemma will need to be creatively developed, starting with support from this council to then partner with interested parties in our states. Having lived in the outlying Tucson area for 12 years, I believe this community can be a lead agent for change for other cities and states to follow. There have been some private groups teaming together, often spurred into action by parents that have successfully developed solutions to a different kind of housing option for people with disabilities, driven by the lack of options through government services. I come today to you guys in hopes that the conversation of where my daughter could live that doesn't make my stomach churn and the feelings of unease envelop me could truly start with the word fair. When my other kids leave my home, the options for housing is endless. For Macy, because of her disability, her options are very limited. This is not fair. It has been said to me before, Marianne, life isn't fair. The more you get used to that, the easier off life will be. This line of thinking belongs to the beaten down individual that sees no hope. Fairness is an interesting concept, though. I saw a comic strip recently where there's a line of animals and they were lined up to apply to be in the circus. And the man at the desk says to the elephant, penguin, monkey, and dog, for a fair selection, everybody has to take the same exam. Please go climb that tree. The monkey did a fist pump, and the rest were like, oh goodness. To me, that is an error in understanding fair. Fair doesn't mean give everyone the same thing, but giving what is needed. To illustrate this, imagine 3 kids, all different heights, hearing a baseball game, just starting beyond the fence. They say, let's go watch. They all walk up to the fence and look. There are even 3 of the exact same crates just waiting for them to stand on to look over the fence. All 3 kids get on the same height crate to look over and shoot. Only one of them can see over the fence. In fact, he didn't need any help at all. He was tall enough, he could already see over. The other 2 needed different height crates to be added for them to be able to see over. Fairness and equity are the lenses that I'm asking this council to look through when addressing the issues surrounding housing for those with disabilities. To highlight just a few challenges for my daughter, let's start with safety. She does not understand safety in every aspect. Stranger danger, people taking advantage of her, whether it's financially or her body or personal belongings. People with disabilities face significant barriers to financial stability and live in poverty and then are lumped into low-income housing options. Most having a disability can be considered to be a disadvantaged person living in segregated communities and remain disproportionately affected by high violent crime rates. Sadly, there are still societal and institutional barriers for Macy to gain employment, which will leave her living in poverty for the remainder of her life. Just because she will be financially marginalized for life due to her disability, she should not have to live in neighborhoods that are not safe. She will need female providers to assist her with eating, dressing, changing her diaper, everything. What professional female will feel safe coming and going to Macy's home, sitting in a crime-ridden neighborhood? Other barriers and impediments. Rental units are considered accessible if the front doorway is widened. Many other modifications are not considered when making the unit accessible, such as a transfer space into the bathroom, getting in and out of the bathtub, or a cupboard height in the kitchen. The number of accessible units needs to be increased using the universal design perspective. In the same thread of renting, there are significant financial barriers to rent, including requiring first and last month's rent as a deposit. A person with a disability does not have that kind of cash flow who are fixed on a Social Security income. Some requirements make it nearly impossible to find housing. These issues do not only impact people with physical disabilities, though, they also impact anyone who may be into an age barrier, which is a lot of our elderly locals and winter visitors. I'm sure the Southwest Fair Housing Council knows many more impediments and barriers, numbers, facts, and data. I'm just a mom looking at where my daughter Macy could live, and I'm discouraged. Change needs to happen. Change needs to happen. Change can happen. Barack Obama said, change will not come if we await for some other person or some other time. We are the ones they've been waiting for. We are the change that we seek. Mayor and town council members, I ask that you guys be the lead agents for change for Macy and so many others in our communities waiting for fair housing. And I thank you for your time.
Thank you.
Thank you so much for your time. Really appreciate you making the time to come and speak to us. Mr. Clerk, are there any other speakers waiting on the queue?
No, Your Honor.
Okay. I do also want to note for the record that Mayor and Council received comments from Tom Litwicki from the Old Pueblo Community Services. We also received comments from Hannah Wolke from Direct Center for Independence talking about accessibility and ADA housing availability. Haley Tommen, Associate Director of Direct Center for Independence, also talking about ADA accessibility and there not being enough units to support ADA accessible and people living with disabilities. And then also Steve Fristow, that works for Direct Center for Independence. I believe we also received Gail Booty from Direct Center for Independence, noting the same concerns, as well as Marianne Scott, noting concerns about not having enough accessible units for people living with disabilities. Just wanted to make sure that we had that as part of the record. And I believe that was it for this particular item. So,
Madam Mayor, I move to close the public hearing and acknowledge all those the outstanding speakers that just spoke and also the ones that sent in their comments.
thank you so much, Mr. Fimbres. There's a motion. Do we have a second?
Second.
Second.
There's a motion and a second to close the public hearing. All those in favor indicate by saying aye.
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 Any opposed? Motion passes 7-0 to close the public hearing. Mr. Clerk, you are requested to read Resolution 23174 by number and title only.
Resolution number 23174 relating to public housing, approving the City of Tucson, Pima County fiscal year 2020 through fiscal year 2024 5-year consolidated plan, including the city fiscal year 2020 annual action plan and the analysis of impediments to fair housing and declaring an emergency.
What is the council's pleasure?
I move we pass and adopt Resolution 23174.
Second.
And I believe the resolution is 23172, Mr. Clerk?
23174, Your Honor.
Okay, I have the wrong one. Alrighty, so there's a motion and a second. Any discussion? Roll call.
Mr. Durham?
Aye.
Mayor Romero?
Aye.
Mr. Fimbres?
Aye.
Mr. Cunningham?
Aye.
Ms. Santa Cruz?
Aye.
Mr. Kozaczek?
Aye.
Mrs. Lee?
Aye.
Resolution 23174 passes by a vote of 7-0. Item 10.
Personnel matters, reappointment of the city attorney, ordinance number 11754.
Oh my God.
The city manager's communication number 148 dated May 19th is received into and made part of the record. Mr. Clerk, you are requested to read ordinance 11754 by number and title only.
Ordinance number 11754 relating to the city attorney, appointing the city attorney, approving extension of employment agreement, and declaring an emergency.
What is the council's pleasure?
It's my pleasure. Sorry. Go ahead, Paul.
Oh, go ahead. Go ahead and make the motion.
Thank you. It's my pleasure to motion to pass and adopt ordinance 11754.
Second.
There is a motion and a second. Any discussion?
Yes, Your Honor.
Vice Mayor.
Your Honor, I wanted to tell everybody that I've been working with Mike Rankin for a decade now. And I actually came out of this council a decade ago, almost this week. And this 10 years, I've learned a lot. And I want to say that, when we first came on to this council 10 years ago, speaking very frankly, there were a lot of questions about Mike Rankin. And I can tell you right now that over the last 3 years, he's probably developed into one of the best city attorneys, not only in the state, but in the nation. I know for a fact that different city attorneys around the nation call him for advice, and he's guided us in so many different legal, not only legal, I wouldn't call them victories, but just good legal decisions over the past years. Mike, I want to recognize and thank you for your service. I know it's continuing, and we're lucky to have you. And I don't think I think a lot of cities would would be envious to have a city attorney like you. So congratulations on your reappointment.
Thank you. Thank you for your comments.
Mike Rankin, I also want to thank you for your service to our community and to us. You've been a great resource for us, and thank you.
Thank you, Councilmember Fimbres. I think there's still a lot of questions that remain about Mike Rankin, which I'm kidding. I've had the pleasure to work with Mike Rankin for the last 12 years. We're going on 13 years of working together. And I know that Mike really strives for excellence. You know, where in previous extensions of his contract, I've sat with him and asked him to really help the mayor and council get to where we need to get to provide services, equitable services for our community. We've had really hard issues at the table that we've really had to go to bat, right? We've had to go out swinging on issues that were not easy, complicated issues, issues against the city of Tucson going up against the state. And Mike has always given us very good, steady advice based on the wishes of the elected officials of this community. And so I really appreciate your time, your effort. I know that you work 24/7, Mike, and really appreciate you not just as a city attorney, but an individual, a person that cares about what we do for the residents of Tucson, and I appreciate that.
Thank you, Mayor.
Did any of my colleagues want to add any other comments, or I also wanted to open it up for Mike to say a couple of words, if you so please.
I had a comment.
Go ahead, council member.
It's a question. Is this why Mike got all dressed up today and did not choose to wear his tie-dye t-shirts and knee-high socks?
You haven't seen me stand up yet, though.
I just wanted to add that I got to meet Mike Rankin a little over 12 years ago, and he had a lot more hair when all this happened. But that I, just appreciate how hard you work, to serve our community, and that I also had the pleasure of having your daughter as a student at the U of A, and that I got to know more about you through her. And so I really appreciate, your history and your commitment to this community, and I look forward to working through another term with you on that.
Thank you very much.
Mr. Rankin.
Oh, Mayor, I think I'm going to keep it short. I do want to thank one person in particular, though, and that would be my wife, Catalina, who puts up with a lot. You all know how hard these jobs are and the sacrifices we make, but it's really the sacrifices of the people who are at home waiting for us, usually late at night, to finish up what we have to take care of here. So I've said it before, and I will say it again. I wouldn't have been able to do this job for 18 minutes, let alone, 18 years. If we get to 18, we'll see, without her help. So thank you to her.
And I know that you've celebrated graduations of your daughter this week and your son this week. So I just want to congratulate you, and hopefully after the meeting you can go and celebrate with your kids and your beautiful wife. That it is really, as you said, a very important reason as to why you stay, first and foremost, and secondly, why you do excel in this, because it is their support, your kids and your wives and your family support, really keeps you going. So with that, thank you so much for your service to the residents of Tucson, and I'm looking forward to another term with you.
Thank you.
All righty, so where are we? Are we in the roll call?
Yes, we are, Your Honor.
Righty, let's do roll call then, Mr. Clerk.
Mrs. Lee,
Aye.
Mr. Kozaczek,
I suppose.
Ms. Santa Cruz,
I want some time on the basketball court with Rankin.
I'm ready.
Oh, wow.
Mr. Fimbres,
Aye.
Mayor Romero,
Aye, and I'll stay on the bench.
Mr. Durham,
Aye.
Mr. Cunningham.
You know I'm showing up for that one. Aye.
All righty, ordinance passes. Ordinance 11754 passes by a vote of 7-0.
Thank you again.
Thank you. And we are on item 11.
Adjournment.
Council will stand adjourned. The next regularly scheduled meeting will be on Tuesday, June 9th at 5:30 p.m.
So is the May 27th simply a study session?
I believe so, yes. All righty, we are adjourned. Thank you all so much for your hard work.
X.